I'm admitting additional members of the public from the lobby now.
Santiago, will you let us know once you've let everyone in?
I will.
Thank you.
At this time, everyone from the lobby has been admitted. I'm sure additional people will come in, and I will admit them as they come in.
Thank you. Good morning. This meeting of the Agricultural Labor Relations Board is now called to order. Welcome. Before we get into the formal agenda, I want to note that all meeting participants and members of the public will need to select their preferred language that they would like to hear the meeting in. If you are in Zoom on either your computer or through the Zoom application on your mobile device, please go to the bottom right. You can select interpretation and then select either English or Spanish, whatever your preferred language is. You must select one of these languages in order to hear the meeting and properly participate. Unfortunately, language interpretation services are not offered if you are dialing in only from a mobile device and not using the Zoom application. Interpreter, can you please relay these instructions in Spanish, please? Santiago, I'm not able to hear the interpreter. Is this on the other channel? Santiago, were those instructions given? I'm not able to tell. Can you go off audio? Go off mute? Okay. Gracias. Thank you. We are very appreciative for our interpreter services this morning. I will now do a roll call for identification purpose only of our board members. Board Member Broad. Here, I see he's here, but on mute. Board Member Flores.
Present.
Board Member Hall. Board Member Hall relayed that he may have difficulty joining the meeting this morning due to some last minute issues, so hopefully he can join later. Board Member Lightstone.
Present.
Wonderful.
I'm here. I'm sorry, I had it on mute.
Thank you, Board Member Broad. Good to see you. Also present from our staff for today's meeting are Executive Secretary Santiago Avila Gomez and the Assistant to the Chair, Ed Haas, who are providing technical support. I also want to thank them, Board Member Flores, and other members of the administrative staff who worked hard to ensure that we could offer simultaneous translation via the teleconference option. As we all know, we're living in a rapidly changing time, and the board is committing to taking the steps necessary to protect the health and safety of both our staff and members of the public. Thus, in accordance with Governor Newsom's executive order N2920, today's meeting is being held via video conference with an option for members of the public to dial in. As reflected on the agenda, today's meeting will have two main parts. First, we will have the open session business portion of the meeting, where we will address several items and hear various reports. And during the second portion, we have several informational panels constituting labor, management, community-based organizations, and advocacy groups that will share their perspective on how COVID-19 is impacting California's farm worker population. At the close of the business portion of the meeting, we will open the meeting up for public comment on any portion of the meeting. Members of the public who have contacted the board, either by email or phone, and asked to be placed in the public comment queue will be called on in the order received. If you did not previously contact the board and wish to make a public comment at the end of the meeting, you may do so in one of several ways. You can use the raise your hand feature, or message the executive secretary in the chat function, or email Santiago Villagomez to be placed in the queue for public comment. We ask that you also provide your name and organization if applicable. This information will become a part of the public comment, will become a part of the official record of today's proceedings. We will take public comments in sign-up order. We will then open public comment to anyone on the call who was not able to enter the queue. If you wish to speak more than once, please alert staff and have your name placed back in the queue. If you have technical difficulties when you are called up, please reach out to us via the Zoom chat function or email, and we will do our best to come back to you. We do have limited capabilities for managing participation during the meeting and during the public comment periods. So we're asking everyone who is not speaking to place their phones or Zoom on mute and wait to unmute until you're called to speak. You can also see these instructions on the agenda, which is posted online at www.alrb.ca.gov under the meeting notice, which is also listed on our homepage. Okay, we'll now proceed to the open session. Our first agenda item is approval of the June 23rd public meeting minutes. Members, may I have a motion for approval?
So moved.
Thank you, Board Member Flores. May I have a second?
Second.
Thank you, Board Member Robb. All those in favor, aye?
Aye.
Meeting minutes are approved. We also had the Regional Directors Quarterly meeting on June 23rd. May I get a motion to approve the minutes from the Regional Directors June 23rd meeting?
I'll move it.
So moved.
Thank you,
Second.
Member Lightstone. May I have a second?
Second.
Thank you, Board Member Broad. All those in favor, say aye.
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 So moved. The Regional Directors meeting minutes are approved. Okay, we will next move on to the next agenda item, which is the Chair's report. First, I am very to report that since our last meeting, two of our colleagues, Board Member Hall and Board Member Ralph Lightstone, were heard in the Senate Rules Committee and recommended for confirmation and approved by a floor vote of the California State Senate. Please join me in congratulating them on their successful confirmation. We are grateful to have two amazing and knowledgeable colleagues join us on the board, and I am sincerely thankful to Governor Newsom for these appointments. Additionally, on June 30th, Governor Newsom appointed Sebastian Sanchez to serve as the Associate Secretary for Farm Worker Liaison and Immigrant Services at the Labor and Workforce Development Agency. We are very excited to work with Mr. Sanchez in this new role and to help improve how our state serves farm workers. I believe this is Mr. Sanchez's first week on the job, so we plan on inviting him to our next meeting in October. As we are all too aware, oh, I believe he's here. Hello, nice to meet you.
Hi, thanks for having me.
Welcome.
Welcome.
Excited. Do you have any words for us, Mr. Sanchez? Anything you'd like to share?
No, it is literally my second day on the job, so I'm just here to listen and learn. So thank you.
Well, thank you. We'll definitely have to have you back more formally once you've had a week under your belt. So we're so excited you're here. I've heard wonderful things about you from some of my colleagues and other members of the community. So thrilled that you've come to join the administration and help us improve our work for farm workers.
Thank you.
As we are all too aware, COVID-19 has been a significant impact on the state. and it's one of the largest issues that we have ever faced. This has impacted each and every one of us and certainly affected essential workers, particularly farm workers. Given our role as the only state agency that's sole mission is to serve farm workers, we have been critically looking at our own role and what we can do. At ALRB, our role is to protect the working conditions and collective action of farm workers and foster collective bargaining. So we do have limited jurisdiction in this role. And we've examined how we can better assist and have an impact during this, this significantly challenging time. The COVID-19 crisis is several crises. It is first and foremost a public health crisis, and also a severe economic crisis. And at the juxtaposition of those issues are the nature of work and working conditions, and specifically the working conditions of farm workers. Given our role and what we've been looking to do, we see one of our main roles as an outreach and education entity focused on farm workers. And so this is the second of 2 meetings that we have held in order to have a forum to discuss the impact of COVID-19 on the farm worker population, to provide a forum to discuss the issues solely focused on this workforce population, and hopefully amplify issues and concerns and make sure that those issues are being elevated and connected to the right appropriate agencies, whether they be state or local or community organizations. Additionally to that, the ALRB staff identified, along with several other of our sister agencies and departments across government, a need to have better coordination by the administration to help address the needs of the farm worker population during this time. To that end, we have been participating in a weekly internal working group focused solely on farm workers with members of our sister departments and agencies, EDD, Cal OSHA, the Labor Commissioner's Office, the Labor Agency, Department of Public Health, Housing and Community Development, Department of Food and Ag, and Governor's Office staff, in order that we can better discuss what the issues that are going on, rapidly respond, see how we can leverage outreach and education opportunities, and quickly troubleshoot issues that we're hearing on the ground. I will continue to bring reports of this internal working group to the board for discussion. This is a relatively new group that we met several times, but we are hoping that it can be effective to help address the needs of the farm worker population. In closing, one of the main issues that has come up in these discussions has been about, what are the issues that we think farm workers need to hear? What are we hearing? And one of the things that we are hearing is that there is not as great of awareness as we would hope about the option for paid sick leave for this farm worker population. Under the Federal CARES Act and under Governor Newsom's order, subsequent order to fill in the gaps, all farm workers are eligible for up to 80 hours of paid sick leave if they are advised by a healthcare provider to stay at home and isolate, or by a federal, state, or local quarantine order specifically to self-isolate. So I wanted to highlight that. That's a critically important benefit for the health and safety of not only that worker, but of their colleagues, and one that's very important. They have that right to paid sick leave, and we're hoping to elevate that during this meeting. And with that, are there any comments or questions? I also would ask, if you are not on mute, if you're not speaking, to please go on mute, as there are some background noise. Thank you. Okay. Seeing no questions, I will move on to the next agenda item, which is the Executive Officer's Report on Elections, Unfair Labor Practice Complaints, and Hearings. Santiago Villa Gomez.
Thank you, Chair. So since the board's last public meeting on June 23rd, all of the following has occurred. There's been one notice of intent to take access filed by the United Food and Commercial Workers Union Local 324 at 7 Points Management, doing business as Walnut LLC in Long Beach, California. It's a cannabis industry employer. That NA was filed on July 20th. There have been no notices of intent to organize or NOs filed. No petitions for certification or decertification filed. There's been one complaint filed by the General Counsel, and that's in Chapala Berry Farms, filed on July 2nd, and Santa Cruz County, California employer. There's been one post-complaint settlement in Pacific Fresh Produce Incorporated The parties entered into an informal bilateral settlement agreement. The notice to take hearing off calendar was filed on July 30th, 2020. Since our last meeting, we haven't had an in-person or virtual hearing held. There's been no ALJ decisions issued or board decisions or administrative orders. At this time, pending are three matters before the board, 2 for board decision, 1 for administrative order. The 2 board decisions pending are in Rincon Pacific, LLC. The briefing was completed in that matter on February 21st. And Smith Packing Incorporated, the briefing completed on June 15th. And finally, United Farm Workers, Flores Ramirez. That matter is awaiting board action and administrative order, and briefing was completed on July 17th, 2020. That is the end of my report. Please let me know if you have questions for the public. It has been brought to my attention that the reports are not yet on our website. However, we'll endeavor to have those up as soon as possible.
Any questions? Okay, thank you so much, Santiago. Next is agenda item number 5, the litigation report presented by Todd Ratchin.
Hey, good morning. Can you hear me okay?
I can, yes.
Okay, excellent. I had submitted a report with litigation updates to the board. Unfortunately, it doesn't appear to have made it onto the website yet. So there have been a few litigation matter updates since the last meeting in June, so I'll try to rattle these off quickly. In Wonderful Orchards versus ALRB, a petition for writ of review of the board's decision in 46 ALRB number 2. Wonderful Orchards filed its opening brief on July 17th, and the board's respondent brief is currently due August 21st. In United Farm Workers of America versus ALRB, a petition for writ of review of the board's decisions in 45 ALRB numbers 8 and 4. The UFW filed its opening brief on July 7th. There was a stipulated extension of time for respondents' briefs, which was granted so that the board's respondents' brief and Rowan Farming's opposition brief to the petition are due on October 9th. In P&M Vanderpool Dairy versus ALRB, which is a petition for writ of review of the board's decision in 44 ALRB number 4, the court issued a remitter on July 8th, 2020, formally returning the case to the board, and that litigation now is complete. In Rowan Farming Inc. versus ALRB, a petition for writ of review of the board's decision in 44 ALRB number 1, the court issued a published opinion on July 15th, which is reported at 52 Cal App 5th 141, upholding the board's decision and remedial order. And then finally, last but certainly not least, on July 29th, Cedar Point Nursery and Fowler Packing Company filed a petition for writ of certiorari in the United States Supreme Court, seeking review of the Ninth Circuit's opinion rejecting a constitutional Fifth Amendment takings challenge to the board's access regulation. The docket for the case is available at the United States Supreme Court's website. The case number is 20-107. Currently, the board's response to the petition is due on September 2nd. And that is it for the litigation updates.
Thank you so much, Todd. Do any of my colleagues or members of the public have any questions or comments? Okay, moving on. The next item on the agenda is item number 6, the General Counsel's report from General Counsel Julie Montgomery. Julie?
Thank you, Board Chair Hasid. And I want to begin by congratulating board members Lightstone and Hall on their successful confirmation hearings. So welcome. So at the General Counsel's office, or in the General Counsel program, which is where the vast majority of the ALRB staff work in our 5 regional offices, we have been very busy in responding to just what we see as a crisis, responding to the needs, right, of this crisis of farm workers and agriculture just being hit with COVID-19 cases and just all of the concerns. As Board Chair Hasid mentioned, we hear that a lot of workers don't have information about their right to paid sick leave and other benefits. So we are putting a significant amount of resources into working on a coordinated project or a variety of coordinated projects together with the Labor and Workforce Development Agency and other departments under the agency, in particular the Department of Industrial Relations, which encompasses the Labor Commissioner and Cal OSHA, as well as the Employment Development Department. And we have a number of staff working on this project to develop more effective and strategic outreach to the farm worker community, as well as having a more streamlined and effective referral system so that people don't have to guess who to call for what issue they have. And we at the ALRB are putting ourselves forward as a general resource for farm workers to assist with those referrals. We are also working in coordination with these different groups to develop materials for farm workers on COVID-related resources, such as the right to sick leave, health and safety, disability, and unemployment insurance benefits. And we are going to be working with a lot of our community partners as well to broadly distribute that information throughout the state and get the content in language that is accessible to workers as well as Indigenous language speakers. And we're also developing strategies as part of this project through remote platforms to do outreach through remote means such as videos for social media. Additionally, a number of our staff have appeared on radio and television interviews and presentations, and this is an ongoing effort. For example, just since the last board meeting, we've had our staff do radio and TV interviews on Radio Bilingüe, Univision, Radio Indígena, and some of those have been broadcast on Facebook Live, and there have been others as well. And we've had content in both Spanish and Mixteco. And in our regional offices, we do have 2 Mixteco speakers who are very helpful in these efforts. We are also hiring additional staff to assist with outreach, referrals, and coordination with our sister labor departments. So we have those positions posted on our ALRB website. There's a link that says job opportunities on the left-hand column. So please check those out, help spread the word. We are accepting applications for those positions. We also have a number of our staff working on a variety of regional and statewide task forces to address the problem of COVID spread among farm workers and in agriculture, including the Central Valley Task Force to address these needs. And our regional director, Chris Schneider, is serving on that task force, as well as some of the staff in our Visalia region. With respect to our office operations, we are open. We have one office in Santa Rosa that is in an EDD office that's closed to the public because that's managed by the Employment Development Department. However, our staff still is in the office and they do meet with workers by appointment and they're available by phone. In the remaining regional offices, we staff them every day. We have people present in the office, and we've implemented social distancing and other safety measures to protect our staff and the public. And we have people staffing these offices on a rotating basis so that we can be available and present for people who need us. And so please feel free to continue to refer people to our offices. Either they can come by in person or they can call our 800 number or any of our regional office numbers for assistance. And we are still continuing to meet with people with these protective measures in place. And I mentioned that we have our outreach positions available. We also have a field examiner 2 and an attorney position that we will soon be hiring for in Visalia. So again, please help spread the word in addition to our outreach positions. And finally, I'm going to just outline a couple of settlements or highlight a few settlements that the General Counsel program has reached since the last board meeting. The vast majority of results that we get for farm workers occur prior to a board decision, or they never get to a board decision because they are resolved between the General Counsel and the parties before hearing. And that is the vast majority of our cases. And so at these meetings, I do like to give a brief overview of that work just because it's not among our listed board decisions, but they're very important results that our staff is working hard to achieve for our charging parties every day. So we just yesterday, I found out, finalized a settlement for a worker at Verway Farms Dairy in Kings County. And in that case, the worker alleged that he and 5 other workers were terminated after they engaged in a work stoppage following complaints about overtime pay and discrepancies in their paychecks. The General Counsel's staff investigated, found reasonable cause that a violation of the act occurred, and we did file a complaint, and the case was set for hearing later this month. And this case settled for back pay in the amount of $77,139 for the 6 workers, as well as reading, posting, and mailing. That's a noticing to the workers of the violation. And we're going to conduct supervisor training for the dairy supervisors. We also achieved a settlement for workers who were working at Matera Farming, which is a pistachio farming company in Kern County. And they claimed they were fired for complaining to their foreman about the company not evenly applying a policy about when employees can assist each other to complete their work. So it was a complaint about some working conditions relating to a company policy. And the workers claimed they were fired after complaining about that. And the case settled pre-complaint. So we were in the investigative phase, and the company agreed to pay just a little bit under $21,000 to the 2 workers, which included back pay and front pay, as well as for the reading and noticing to the employees at that company. And finally, we, as Mr. Avila Gomez mentioned, we received a favorable result for workers harvesting and bunching herbs and vegetables at Pacific Fresh Produce in Oxnard. And in that case, a worker and his wife alleged that they complained to the company that they were not being paid as promised, and that the company retaliated against them by giving them undesirable work, issuing warnings, and also terminated the husband. The General Counsel's office investigated and found reasonable cause that a violation occurred, and we did issue a complaint, and that hearing was originally scheduled to start today, but it did settle for $27,000 in economic losses for the 2 workers, in addition to reading and noticing to employees at the company and the farm labor contractor, as well as a posting. So those are just a few of the ongoing settlements that we have achieved and some results for workers in our cases. So with that, that concludes my report, unless there are any questions.
No questions, but thank you so much, Julie. Do any of my colleagues or members of the public have questions? Okay, thank you so much, Julie. And I'd also like to reiterate, I'm very grateful to the Labor Secretary and Governor Newsom and the legislature for approving the outreach positions. The General Counsel and I and our staff are very excited about them, and that those efforts are still being prioritized, especially now as we realize how important it is to improve our education and outreach to the farm worker population. So very excited to see those positions posted. Check that out. Hopefully we'll get some good candidates for that. Thank you. Before moving on to the next agenda item, I do just want to pause because we have had significant increase in participation since the start of the meeting. If you are just joining us, In order to have optimal audio while you are listening to the meeting, if you are dialing in via Zoom on your computer or via the Zoom app on your mobile phone, please select your preferred language. We are offering simultaneous translation in Spanish. You can check either English or Spanish. You should check one language in order to have optimal audio conditions. Unfortunately, if you are dialing in by phone number only, you are not able to have the simultaneous translation feature. Interpreter, can you please share that, that reminder? Thank you very much. Okay, next I will go on to the next agenda item, number 7, a report. Do we have a report from the Division of Administrative Services from Brian today?
I just have a couple of real brief updates from our last June meeting. Hi, Brian Doherty, Chief of the Administrative Services Division. I'm happy to report that on July 29th, ALRB submitted its year-end financial statements to the State Controller's Office for fiscal year 2019-2020. Out of our $11.3 million budget, we finished the year with a $755,000 budget surplus. As we spoke at the last board meeting, the majority of that surplus was a result of the Department of Finance budget letter 2011, which was issued on April 30th, which was associated with the current year expenditure reduction plan to limit the amount of expenditures associated with state government in response to the rising expenditures associated with COVID and the budget shortfalls that were projected. Department of Finance has also recently released a budget letter about this upcoming current year budget cycle, and that there will be a forthcoming budget letter that will be issued shortly that will ask all state departments to come up with a 5% operating reduction from its operating expenses and equipment line item budget. So more details will be shared once that budget letter is released, but the staff of the administration division are beginning to look at options available on how we can implement such cost savings in response to that requirement. In addition, as part of the final signed budget for fiscal year 2021, ALRB did receive additional funding through the budget change proposal process. We received $1,051,000 in 3-year limited term funding to support the outreach activities that our General Counsel, Julia Montgomery, talked about, which is currently funding the training and community engagement specialists in Visalia and Salinas that were spoke to that are at the AGPA level that are currently being advertised, along with the staff services manager one, outreach and program manager, and director of communications. So those 3 postings for the new positions are currently out and awaiting applications. So those are the brief updates I have for the administrative division, unless there's any questions.
I don't have any questions. Do any of my colleagues have any questions? Any members of the public? Okay, thank you so much, Brian. So appreciative of all that you and your team are doing. I know got a lot going on here. Okay, next is agenda item number 8, the regulations report. Todd, is there anything to report?
No regulations updates to provide.
Okay, thank you. I do want to follow up on a comment by Board Member Broad from last meeting in June, asking for a review of the ALRB's regulations. In light of that comment and other feedback, we will be conducting a review of our regulations, and I would like to invite all of our stakeholders to send us feedback on what may need to be revised, reviewed, updated, or added. Please share those thoughts via email with our Executive Secretary, Santiago Avila Gomez. His email is available on the meeting notice for on this meeting's agenda. We welcome that feedback. I'm also designating 2 board members to serve as a subcommittee to work with our staff to review that feedback and help develop recommendations in the coming months. Those 2 board members are Board Member Broad and Board Member Lightstone. So I'm designating them for this purpose. Any questions or comments from the board members or members of the public? Okay, great. Next, I'm moving on to agenda item number 9, the legislative report.
No updates.
Okay. Moving on to agenda item number 10, the personnel report. The board has no personnel items to report, so I will now move on to agenda item number 11, which is the public comment. Please be advised that the board is unable to adjudicate, comment, or resolve any pending case matters before the board. I will ask our Executive Secretary, Santiago Avila Gomez, to go first through the queue and then open it up for other additional comments. You will have the opportunity to also comment and ask questions of the panelists. If you have technical difficulties or miss your turn, we'll work to come back to you. Please remember to be on mute unless you're speaking. If you require translation, please advise us. Okay. Do we have any public comment?
Remind the public, sorry, I have my mute on. So I'd remind our participants that if you wish to make a public comment, please either raise your hand using the Zoom feature or use the chat box. At this time, I don't have any requests for public comment from our participants in this meeting.
Okay. I would like to advise that we are in receipt of a written public comment from Ed Kissam of the WK Family Fund ahead of the meeting. These comments will be included in the minutes for the public meeting. Okay, we'll now turn on to the second of our 2 informational panels on COVID-19 and its impact on agricultural industry and on farm workers in particular. As we know all too well, COVID-19 has radically impacted how we all live our lives, including how we work. Given the board's mission and focus, we wanted to learn more about COVID-19 and how it's impacting the agricultural sector and specifically farm workers. At our meeting in June, we received a primer on COVID-19 and heard from health and safety experts, as well as from our state enforcement partners, the Labor Commissioner's Office and Cal OSHA specifically. Today, we'll hear from multiple stakeholders, including representatives from labor, from employers, from community-based organizations, and from advocacy groups. I also want to note that we have all been following very closely reports in the news, including a recent Frontline episode, as well as numerous reports in local media. I do want to acknowledge that we are here to listen. We are eager to hear your perspective of what's going on the ground. I have heard concerns, unfortunately, regrettably, but understandably, from members of the farm worker community that they are all too often not being at the table and not being consulted when working with government agencies and others that are trying to provide aid and resources during this time. So I want to emphasize that We are here to listen. We are very grateful for your participation and very eager to hear from all of our panelists here today. With that, I would like to invite our first panelist to speak today. These are representatives from the California Institute for Rural Studies, or CIRS. They, in collaboration with multiple other agencies, have conducted a farm worker survey in California, Oregon, and Washington, and released their findings about 2 weeks ago. They have generously agreed to present their findings to the board today, along with recommendations. Please let me introduce the CIRS Executive Director, Ildi Carlisle Cummins, Dr. Don Villarejo, one of the co-founders of CIRS, Irene Di Berquia from Líderes Campesinas, Nayamin Martinez from the Central California Environmental Justice Network, and Auralia Maceda of Centro Binacional Huaqueno. Ildi, I turn it over to you for your presentation.
Great, thank you, Victoria, and thank you to everyone, all the members of the ALRB and everyone else who's here to hear what we have learned from farm workers conducting the COVID-19 farm worker study over the last few months. As Victoria mentioned, I'm the Executive Director of the California Institute for Rural Studies, and I am really in a facilitation role here. We have put together a deep bench of researchers and folks connected to the policy world, as well as a core group of 6 farm worker serving community-based organizations across California who are really at the heart of this study. And it was through their trusted networks of farm workers who they've been working with for many years that we were able to get information on how COVID-19 is currently affecting California farm workers. We conducted a phone-based survey beginning in the middle of May and ending in July. That talked to over 900 workers in 21 counties across the state, and I'm going to let the team tell you about highlights from the findings there. But I'll say that our preliminary data brief that we released yesterday, or a couple weeks ago, I'm sorry, feels like yesterday, it's been a whirlwind, that we released a few weeks ago is based on 745, an analysis of 745 of those 900 plus surveys. And we're going to be releasing full data briefs on each of the subject areas within the survey. So workplace conditions, workers' ability to protect themselves at home, healthcare access, transportation, and economic issues. We'll be releasing full data on each of those in the coming months. But we felt like, as you mentioned, it was really important for farm worker voice to be heard directly in these policy conversations and in the public conversation about COVID-19 right now. And so we worked quickly to be able to have sound data and well-analyzed data to enter into that conversation. So you'll hear from the team on the findings of that study. And I think that there are some really powerful insights here that I'm glad to hear are maybe already affecting the way that the ALRB and other state agencies are conducting business right now, particularly in reaching out to Indigenous farm workers in their native languages and other findings like that. So you'll hear from the team that Victoria mentioned now, but before we move to the survey team leads, who are Irene de Barriqua from Líderes Campesinas, Nayamin Martinez from the Central California Environmental Justice Network, and Auralia Maceda from Centro Binacional. In addition to them, there were 3 other team leads, but they're representing our team today. But before we move there, I would like to give a few minutes to Dr. Don Villarejo, who also did some important data analysis over the last few months of administrative data available on COVID-19 infection rate and on job loss in California. So I want to give him a few minutes and then turn it over to our team. Thank you.
Thank you much, Ildi, and thank you, Board Chair Hasid, for the opportunity to meet with you all. The first main thing I want to point out is that agricultural workers are a vulnerable population. The latest data we have from the Department of Industrial Relations shows that in 2018, agricultural workers were 50% more likely to sustain an occupational injury while working. And that is information that I think is biased in significant ways as compared, as I might say, to the whole population of California workers. I might say that that information is biased because Congress forbids obtaining that kind of information from farms that have fewer than 11 employees. And so the number certainly is larger than what the primary data shows on the website of DIR. The second major point is that few Californians are aware of the devastation of the food service produce sector of California agriculture. When shelter in place went into effect, not only restaurants and hotels and other venues, but schools, colleges, universities, and every venue that depends on the food service industry to provide food to their customers were either closed down or severely limited in their operations. As a result, an estimated $8 billion of California farm revenue for this year has been lost. And as a result of that, unemployment has spread among their employees. In June, the data that we have indicates about 97,000 jobs were lost as compared to the three-year average, 2017-2019. And that is just 1 month, June, those number of jobs lost, roughly 20% decline of statewide jobs in agriculture. And the devastation of that at the community level in due to the lack of income, et cetera, is yet to be measured. The next point is that all pandemics are local. And when this thing began, I searched all of the public record sources to find information about the prevalence of the disease among agricultural workers. And I have to say it was a very disappointing experience because out of the state's 58 counties, only 3 today provide information online about employment of people afflicted with the virus. How can you plan any kind of reasonable interventions if you don't have local information about what is going on? All pandemics are local. I then sent an email to Imperial County to find out why they didn't have that information available. They wrote back, and I quote, "At this time, we do not collect or display COVID positives that are employed in agriculture, period." And a search using the California Public Records Act request to all 8 counties in the Central Valley yielded, unfortunately, very scant information, but did yield legal opinions that that information is not public from 2 of the counties. The main thing that I learned in that effort was that Monterey County is exemplary in providing online access to information about the employment status of all persons in the county who are afflicted with COVID-19. And what I determined was that as of June 30, 2020, Monterey County agricultural workers were more than 3 times likely to become infected by the virus than persons employed in the county's non-agricultural industries. Now understand, this is a one-time snapshot applied to one county. As we speak, 1,250 Monterey County residents who are employed in agriculture are afflicted. Back when I did that study, there were only 605. The number has doubled since June 30. I want to close with just some good news. 8 days ago, Ildi and I and several others on the call were able to participate in an informal coalition put together in Monterey County that included growers, farm worker advocates, health providers, and others. And really good things were happening. I think the good things that were happening included growers paying for the cost of individual workers to privately quarantine, have meals provided, and have visits from health professionals to see how they're doing. And as well, health professionals going to the fields and talking directly with employers, with workers and others to try to encourage participation in the services that are available. These are good things, and I think we need to recognize it. But I need to say at the end that this concealment of information about agricultural workers and COVID is a disgrace to California. And even the state has said through the Department of Public Health, they do not release that information. This is sad because how can you plan any kind of meaningful intervention if you do not know what's going on? Thank you.
Thank you.
Oh,
I'd like to ask one question, actually, if I could,
Sure.
Dr. Figueredo. I have read in multiple places that Monterey has been exemplary. Do you have any insights? Are they only tracking farm work? Are they only tracking the agricultural occupation? And then secondarily, any reason why maybe they have been able to do this more successfully?
Thank you. That's a very good question. I neglected to say that not only do they report information about agricultural workers, they report the employment status of every person diagnosed who is a county resident. That is what industry they're working in, whether they're unemployed, whether they're retired. And unfortunately, what we learn also is that the number of folks for whom they do not have information at this time has grown even more rapidly than the doubling of the number of ag workers afflicted. When I did the June 30 analysis, there were 324 persons for whom they did not have information. Today, there's over 1,400 people for whom they do not have employment information. Contact tracing is a difficult thing. If you speak Spanish, well, that'll help. But what if you speak Trique? What if you speak Mixteco? What if you speak Zapoteco? And so on. Are you trusted? If somebody calls from a government agency and you're concerned about the elephant in the room, which is immigration status, are you going to answer the phone to somebody who calls from the government? Click will go the phone, in my opinion. So yes, they're doing an exemplary job.
yeah. Thank you, Don. And I actually would love to jump on there and then pass the mic to Nayamin and then Auralia and then Irene, because I think what Don just pointed to is something important about this study, which is the findings are critical. The findings should be heard and be put into action to make change. The numbers we've gathered matter, the voices matter, but the methods that we've used here matter also. And as I mentioned, there are 6 community-based organizations at the heart of this study, and they are the ones that are able to communicate out to their networks of farm workers to both relay information that might help protect workers from COVID-19 and be a source of information back about when employers are not complying with guidelines. We're really going to have to lean on trusted networks that have been built on the ground by community-based organizations to be able to tackle this problem. So I would hold them up as a resource and a model as well. So with that, I'll pass it to Nayamin Martinez from CCEJN. Thanks.
Buenos dias. Good morning. My name is Nayamin. I work for the Central California Environmental Justice Network. We were one of the 6 organizations that conducted the surveys in the Central Valley. And, you received our briefing, but I just want to point out some of the things that were more striking for me. One was that many people might think that agricultural workers didn't suffer job losses or income losses because they were essential workers that never stopped working. But the matter of the fact is that they did for a variety of reasons, either because of the way that the workflow was changed as a result of allowing for social distancing. So some workers were asked to work 3 days a week, and then the crews were alternating. So the number of days that they were working were reduced. Or the other reason was that they saw a significant increase in the labor force. So meaning that people that were working in other sectors, restaurants, or were selling things in the flea market, or were in the hair salons that were closed, and they had been formerly farm workers, they went back and worked on the fields. So a woman in Tulare told me, my crew was normally 35, 40 people at the most. Right now we're over 100 people. So we are done with our field in 4 hours instead of a 8 or 9 hour shift. So I'm sent home after having paid for my ride, for childcare for my kids, and struggling because it's not easy to find childcare right now, right? And then she came home with 4 hours of income made that day. So that's the thing that we saw, and it is very concerning because many of these agricultural workers are not eligible to receive any kind of economic benefit, unemployment, or even the federal stimulus money. So they're really having a hard time dealing with this economic hardship. On the other end, the working conditions did not allow all the time for them to be safe. And despite that 90% of them reported that they were taking precautions at home, in the workplace, it varied a lot. 46% said that their workers were providing them face covering, but the rest that said no. And we saw a difference between those that were employed directly with the grower and those that were working with contractors. The growers being more responsible of allowing for social distancing and offering other types of assistance for them to be safe. But in general, we think that many of them were not able to social distance. They did not receive the face coverings. And then the recommendations that were made by CalOSHA at the beginning of the pandemic in their alerts, yes, they were bilingual. Yes, they were distributed, but they were not enforced. And many contractors did not follow them. And on the contrary, were, not all of them, but a few were turning around and selling masks to the farm workers, or were even threatening them. Oh, you don't want to work because I'm telling you that I'm not going to allow you to social distance, then you are not going to have work the rest of the week because there's a line of people waiting for your work. So these are stories that we heard and we're really concerned, and we hope that things are taken seriously and that more enforcement is made so that our agricultural workers.
Oh, Nayamin, it looks like maybe we lost you just at the very end there. But thank you for your words and presentation. And next, can we hear from Oralia Maceda from Centro Binacional?
Buenos días, mi nombre es Oralia Maceda y yo trabajo con Centro Binacional para el Desarrollo Indígena Oaxaqueño. Ahorita nosotros participamos también en este estudio, hicimos encuestas con los trabajadores agrícolas de las comunidades indígenas. Estas encuestas las realizamos en los idiomas mixteco, zapoteco, triqui y tlapaneco. Una gran parte de los trabajadores indígenas son trabajadores de campo, y como ya mis compañeros anteriormente mencionaron, las situaciones que hemos encontrado en el campo para los trabajadores indígenas aún es más complicado por el idioma. Entonces, lo que nosotros vimos en este estudio es de que hay información, la poca información que hay está en español, pero no en idiomas indígenas. Entonces, eso es algo también que está contribuyendo mucho a que el virus esté aumentando en nuestras comunidades, porque no está la información de cuáles son las medidas que se deben de tomar, pero también lo que nosotros hablamos con los trabajadores es de que en el campo sí habían tenido experiencia algunos de que se les había dado la información sobre qué es el virus y lo de cómo protegerse ahí en sus lugares de trabajo, pero en el idioma español. Entonces nosotros como Centro Binacional hemos tratado de también de ir al campo, de darles la información a los trabajadores del campo, de darles cubreboca, pero sabemos que pues esta no es la solución, ¿no? O sea, hay que hacer todavía más y tenemos que trabajar más para asegurar que los derechos de los trabajadores sean respetados. Anteriormente Nayamin también ya comentó sobre que hay una cantidad grande de trabajadores, y esto es porque muchos que no eran trabajadores del campo ahora se han convertido en trabajadores del campo, y nuestro trabajo tiene que ser más duro porque ellos no tienen la experiencia de trabajar en el campo, por lo tanto también no saben cuáles son los derechos que tienen como trabajadores del campo, y cómo los empleadores deberían también de tratarlos. Entonces, ahorita estamos viviendo una situación muy difícil en la que los miembros de la comunidad, organizaciones y agencias como ustedes tenemos que unir nuestros esfuerzos para crear campañas de información en los diferentes idiomas que existen, que son los idiomas indígenas, pero también sabemos que hay otros idiomas, porque nosotros trabajando, yendo al campo, encontramos también a trabajadores de otros países ahí en este lugar, ¿no? Entonces, esto sería algo bueno de que juntos podamos trabajar y crear esta campaña informativa de los derechos laborales.
Gracias, Oralia. Thanks, Araya, for that, and for also leading the effort. You know, more than a third, or approximately a third, more than 300 of the surveys were done within the Indigenous farm worker community. So when you look at this data brief, you should know that also, and that is you know, a rare thing to have data from within those networks of farm worker communities. And the reason we could do that in large part was because of partnership with Centro Binacional, and also with others like Líderes Campesinas, who Irene de Barriqua is our last team member here representing the COVID-19 farm worker study. I'll hand it to her.
Hi, everybody. Thank you, LD. And yeah, so Líderes Campesinas, we are a network of women farm worker leaders throughout the state. And during this pandemic, it's obviously expanded, you know, families, everyone speaking up. You have fathers speaking up about lack of diapers at the beginning, right? When there was a scarce of items in the stores, and stores were being super overwhelmed. So it was really interesting at first to even hear from parents, from males, talking about the childcare issues. Some of the stuff that we've been really dedicated towards as a group is the lack of health care among farm workers. And we're very obviously not surprised with the findings with the study. After, let's see, we found that over half of the respondents reported lack of health care, right? This means either they're going into debt due to healthcare costs, or they don't have insurance, or simply because of immigration status, they are very fearful to go get this healthcare. So that's also one of the major things Líderes Campesinas has been focused on, is getting healthcare to the fields, as well as PPE, masks. Another thing is the safety nets. We're finding that farm workers, being undocumented, many of them, they don't have access to the stimulus checks, to unemployment, to different safety nets that the rest of essential workers do have access to. So I think the coalition, or the collective group of community-based organizations, we all are very focused on healthcare for all. One of the main issues that we find during a pandemic, it doesn't help for everybody to have to keep fighting for this, right? We need farm workers to have health insurance. We are finding one of our cases in one of the surveys was someone who went out to get tested for COVID-19 and ended up having actual, like, an ulcer. So pre-diagnosed conditions are things that we are finding. He ended up with a $56,000 bill, as compared to somebody with insurance who this would have been obviously taken care of. So he makes $27,000 a year, and he's left with a $56,000 bill. So some of the things that we're really trying to do is break these barriers with the agricultural industry, but I'm going to talk more about that during our presentation later. just in regards to getting these healthcare workers to the fields to give up adequate education and talk about the benefits that are available, because we are appreciative of some of the changes that have happened. But pretty much that's all I have to add in terms of.
Thank you, Irene, appreciate it. So I don't know if we have time for questions now, but we're here if you all have them for us.
We do. Do any of my colleagues have any questions for this first panel?
I do. I do.
Go ahead, Barry.
So I know that your data is kind of incomplete because there's patchy reporting, but are employers, like what percentage of the employers are supplying masks and other PPE? And are there employers that are telling farm workers to buy your own masks and come to work? And what, do you have a sense of what percentage of the farm worker population is subject to that? And then the last bit would be, what percentage, or are there, I mean, I've read newspaper stories and stuff to this, that this is happening in some places where employers are forbidding people from wearing PPE or making them work when they're actively employed or actively ill with COVID.
Well, let me, thank you for the question. Let me make just a few comments on the statistics, the data from our findings, and then I know Nayamin maybe wants to make a comment on the provision, the state's attempt to circulate masks out through ag commissioners' offices. I know she has a strong point on that, but I'll just say that our last survey was collected on July 21st. And so we know that situation, there have been big pushes to get masks out there. We recognize that there may be a changing data point here, and our analysis, our preliminary analysis points to an ongoing need for focused attention on mask provision. Only 54% of farm workers we talked to said that their employers are providing face coverings in an adequate way. That means that, slightly less than half said that they either were provided no face coverings at all, or that they were provided inadequate face coverings, meaning they got maybe a mask when the shelter in place order happened, or a couple of masks over a multiple month period, the disposable mask kind. So we really do have data here that says we need to continue to sustain attention on mask provision. And we know that our community-based partners have really stepped in to fill some of these gaps in sewing and distributing masks within their own networks because employers were not providing them. Now, the other piece of data that goes along with that sad statistic on mask provision by employers is that we know that 96% of workers are telling us that they're wearing face coverings. So yes, they're making up the difference when their employers do not provide masks. And that's either, bandanas or home sewn masks or purchased masks that they are buying with their own money. Nayamin, do you want to make a point about mask distribution efforts?
Sure. I just want to say that the state made an effort of purchasing, in bulk, some of the disposable face masks, and they were given to the ag commissioners. I don't know about the rest of the state, but here in the Central Valley, there were various efforts to try to distribute this to farm workers. In Tulare County, for example, the agricultural commissioner decided to not only provide them to the growers directly, but actually they contacted organizations like mine that work with farm workers, and they were giving us the masks. So when we were doing the food distributions or the COVID-19 fund relief that we're giving out, that's when we were also giving out the masks. But in other counties, it was just from the agricultural commissioners directly to the growers. Unfortunately, not all the agricultural commissioners have a good relationship or a direct relationship with farm workers. So that there was a gap in, we don't know if those masks really made it to the farm workers. However, as Sylvie explained, we have been doing our effort of providing face masks, either because we were able to get grants to pay for those, or because we were able to get donations from people that were sewing the masks, or a combination of things. But definitely, I have not heard of what you mentioned of employers saying prohibiting them to wear the mask. I think that there has been a recognition that that's one of the main ways of protecting them. But what I did hear is the other point that you made. Unfortunately, it was brought to my attention by a couple of the people that we interviewed in Tulare County that they were sick with COVID, but they are still feeling frail and ill because they have other conditions like diabetes, and they don't feel that they're healthy and well enough to come back to work, yet their employers are demanding that they come back to work or they're gonna be laid off. So that indeed has happened, or at least I had heard of.
Thank you.
Any other questions?
I have a question.
Go ahead.
Hi, good morning, everyone. Thank you for the presentation. Very informative, super timely. I have a question with regards to some of the safety net programs. I know in the report, the focus is around childcare, food insecurity, financial assistance programs. My question is more to the assistance to farm workers and their family members to stop the spread from COVID-19. So I know recently the administration announced a program, Housing for the Harvest, whereby it would assist with isolation from either folks that have been already exposed to COVID or may have been exposed to someone that was COVID positive. Have you all, I know it's a recent program, but are you in those conversations? I'm hearing that the CBOs are incredibly important to the facilitation and execution of those programs. So I just wanted to see if that was a policy recommendation that you are in favor of, and if so, if you're part of the implementation process.
Thank you for the question. Yeah, we know that overcrowded housing conditions are a huge problem for farm workers to be able to protect themselves from COVID-19. When you have multi-family housing units with folks on the front lines doing essential work for all of us and then coming back together, that is a major failing in terms of our housing system for those communities pre-COVID and going on into this crisis. I wonder, Irene, do you want to make a comment? You've been most closely participating in the Monterey Coalition that has tried to do isolation housing. We did, as Dawn mentioned, we briefed the governor's office a couple weeks back when we first released this data, and they had just announced the Housing for the Harvest program. So I would hope that our conversation is informing the rollout of that, but we haven't been directly involved in the development of that program. Irene, do you want to comment on this?
Yes, so the Housing for the Harvest, it was modeled after the Monterey version that the Grower Shipper Association does in Monterey County. And I think being a part of the Monterey Coalition, we have been able to hear about the progress and sort of analyze what works and what does not, right? CDFA is the one taking on this role. So one of our definite suggestions would be to not only while the person is in quarantine, to have those wraparound services, but to also work with your community-based trusted organizations to encourage folks before they are even sick or come out positive, because people are unlikely to use these isolation homes. And we don't obviously want to just have something that's not going to go to use, which did happen in Monterey County. They weren't used to even a minimum of the capacity that they were there for, but it's nice it was there, you know, just like in Sacramento, we have Arco Arena. The old arena is a beautiful, huge hospital, but luckily it wasn't needed, right? But if we have these quarantine isolation units, we want to have trusted organizations preparing people sort of mentally and, you know, just telling them that it is safe because of all the trust issues that we talk about, afraid of costs, afraid of immigration, government entities. And so, yeah, I think it's great, the Housing for Harvest and the way that they have it set up with the wraparound services. But those wraparound services, from what I understand, are once the person is there, they are going to have community-based organizations bringing food and such. So I'm looking more into how are we working with the program before people come out positive and with the community.
Thank you.
And the same thing goes for like community, for contact tracing, right? We always want trusted organizations to prepare people for that as well. Thank you.
Do any of my other board members have any comments or questions?
Sure. A quick thank you all for your presentation and your ongoing work on this. I just had one question, not about the Monterey point about the data collection that Dr. Villarejo made. I gather there's a lot of blank spaces here in places like Monterey where you're saying they're putting in data that is very helpful in guiding these programs. Is there any progress in spreading that part of the model to other counties?
At this point, I'm continuing to collect the legal opinions about why the data is not public from county officials. And I think we have an opportunity. We have a new state director of public health. And she stepped in and tried to do, you know, as best a job as she possibly could. But we do have some resistance, I think, at local levels, where county officials are fearful of disclosing information that might adversely impact the local economy. And the only case I can point to of that where it was right out front was in the East Coast, where Smithfield Foods had several hundred workers ill. And the county where it occurred, the health officer came out and said, well, we're not disclosing that information because they are the most important employer in our county. And we don't want to, so to speak, tarnish their image. And it's, I think, going to be necessary in the short term to have one of the bills in the legislature right now mandate that immediately all counties begin to do a proper job of reporting. And that would be a way to solve the problem right now.
And Don, there is the AB 685, Assemblymember Rivas's bill that is making its way through the state legislature that would do that, mandate both employer side reporting and public health officer reporting. So we're, you know, in support of that bill.
I believe it's Reyes. Yeah.
I'm sorry, it's Reyes, it's not
Yeah.
Rivas. Yes, thank you for the correction. Yeah.
Yeah, I do that too.
Thank you. Unless any of my other board members have any comments, I do want to open it up for public comment. I did see some comments that were entered into the chat. I believe that that'll be entered, we get a log at the end and that'll be entered into the record. But if any of the public comments that were entered into the chat, if those individuals or organizations want to share that publicly, especially for those on the phone, that would be helpful. Any members of the public with comments or questions for this first panel?
I see one from Hugo Morales from Radio Bilingüe.
Yeah, I just want to thank everybody who made the presentation, Don Villarejo. And, you know, we at Radio Bilingüe and try to, well, that's our beat, right? Following the farm workers. And because we were founded by farm workers and we continue to respect that. And each one of the partners here is a partner with us ongoing. So, but, you know, it's been really hard, as Mr. Villarejo pointedly said, that there's resistance by the counties to provide information, like I was putting in the chat. You know, in Fresno County, there's a, through the local regional foundation, there's a forum every Thursday morning to coordinate about, response to the COVID by not just the government, but also CBOs, et cetera. So there's about 400 folks on the line. And since my participation 3 months ago, I've been asking for this data that he's asking for, in terms of ethnicity, but also occupation of those people that are contracting it, and also deaths. And finally, about 2 months ago, the Fresno County rep who was making the presentation said, we actually have this data of the dead, but from COVID, we have nobody to put that data together. So in the meantime, of course, we know the county has, over $80 million that have been allocated for the federal government. So it's a real sad situation of that direct assistance. At the same time, rather than asking about any directives to employers about, because there are some directives by the Fresno County, to the public, but any directives going to the agricultural employers or the contractors, and that has fallen on deaf ears as well. I mean, it goes nowhere. So there's a lot of frustration by a lot of us that we don't have that kind of information, as opposed to some folks, for example, in LA County, for example, they're providing a lot of good information. Also, there was a lot of resistance about disclosing the ethnicity of the folks that were dying. So finally, about, I think 6 weeks ago, they did provide that information. And about 3 weeks ago, there were about 100 dead, and 69 were Latino, and about, I don't know, a little bit like 20 some were white, and then the rest unknown. So you know that, well, we don't know the occupations. Are the Latinos that died, are they all lawyers and doctors? I doubt that's the case, but that's the way I put it, and there's no answer from the county. And it really is very frustrating, as Villerejo was saying. How can you do a plan, which is part of the reason for this convenience, by the way, every Thursday morning at 9 a.m., if you don't know who are the people being affected with data. So it is very frustrating for those of us that are here in the community trying to address this. And I want to commend all the partners and Mr. Villerejo for doing that study, because this is very, very important and timely. So thank you. And thank you, the ALRB, for doing this hearing, by the way. I'm very, very impressed.
Thank you, Hugo. Good to see you. Good to hear from you too. Are there any other public comments? I did see one other pop up in the chat. If you want to reiterate that comment out loud.
Yeah, hi, this is Rafael Aguilera. I'm with the California Workforce Development Board. Shameless plug, we're working on high road training partnerships, and it's really about trying to find employer and worker collaboratives. And it's, rare in the agricultural sector perhaps, but that's why I'm here. And I really appreciate the ALRB having this presentation today. I'm learning a lot. It's really heartbreaking to hear all the news of how COVID is, tearing apart Latino families, and sad story in the agricultural industry. We're trying to lift up positive examples and find ways to lead in that area. It's long overdue. So just wanted to reiterate that if anyone on this call, whether it be community-based organizations representing farm workers or folks who have relationships with positive employers, employers that are doing good things, that would be great and helpful. We're looking to put out grant money within the next couple of months to fund these type of partnerships. And it's all under greenhouse gas reduction funds, looking to encourage environmentally safe practices as well as worker and employer sort of win-win solutions. So thank you.
Well, thank you for your comment there, Rafael. And I would just draw your attention to the section of the preliminary data brief where we do pull out best practices recommended by workers. I mean, that's another key finding here that deserves some airtime, is that, no one knows better than agricultural workers themselves where the points of contamination and contact are. And we do have a whole section that asked workers for their suggestions. And about 60% of those suggestions were employer targeted. So about better hygiene practices, or, you know, wanting increased bins to consolidate produce into, or, you know, someone dedicated at certain stations to sanitize hands. Like very practical, on the ground best practice suggestions emerged from this. And 30% of workers told us that they wanted, you know, themselves and their coworkers to follow strict COVID-19 guidelines. And so there's a real, to us, what that says is a real willingness and an understanding within the farm worker community that this has to be a collaborative effort between employers and employees, that employees also have some responsibility for taking these on, and a willingness to be in partnership. Again, there has to be a trusting relationship, and we have to address you know, issues of retaliation, because we heard those too when workers make complaints about, you know, COVID-19 practices not being upheld. There's certainly the threat of retaliation, but there is something here about workers, you know, wanting to point to best practices, being a resource for redesigning their workplaces, and they should have a good seat, many seats at the table in designing COVID-19 workplace safety plans, and they're ready for that. So I would direct you towards that section, and certainly our team is here to keep the conversation open about that.
I appreciate that. Thank you. Yeah, that sounds like a great representation of the value of worker voice. And, you know, everybody in different industries has different skill sets to offer. And, you know, whether it be harvesting grapes or going into canneries or meat packing places, every situation is different, but worker voice is always something that should be lifted up. And employers actually have to be willing to listen. And we know in ag, there's a great imbalance of power. And so these partnerships, what we're trying to do is level the playing field and lift up best practices. So thank you.
Thank you. Any other, I think there was another comment in the chat as well. You'd like to share or a question? Okay. Any other members of the public that have comments or questions for this panel? Okay, I'd like to thank all of our panelists so much from Sears and from the other organizations for your work on this survey. I'm excited to see the issue briefs, or eager to see them, I should say, as they roll out, and really appreciate both the quantitative as well as the qualitative aspects of this. I think having the data, although understanding some of the limitations, as well as hearing directly from some of the workers, I really appreciated that, reading that in the report. I think it really helped bring home what exactly is going on out there, and there's a lot. So really appreciate that, and I know we'll be hearing from some of the folks on this panel in a little bit. So with that, I'd like to move on to our hearing from some of our labor representatives. I'll note there is one change to the agenda. We do not have a member from the International Brotherhood of Teamsters. There was a logistical issue in having that representative join today, but I am pleased to say that we do have two members, Lauro Bajaras, the Vice President of the United Farm Workers, and then also Pete Monterino, the Agricultural Division Director of the United Farm and Commercial Workers Local 5. Lauro, are you able to present first?
Yes. Well, I think a lot of the issues that we have witnesses and hearing, it's what already the other people were talking about. So basically the infections of farm workers and deaths, and we have witnessed that the workers reporting to the companies, somebody in my house gave positive, and I have some symptoms. They don't even give them days off, much less paying them for the days for some of them who they took it by themselves. So we've been looking work stoppages, and some packing, and also workers in the fields. So it's the other part. It's the H2A workers. I was talking to 5 of them about a month ago, and a part of the hard work and the lack of quality of food that the some of the companies provide to them, and they were notified that 2 of the co-workers were sick with COVID, and they didn't know, that the company didn't tell them which of the workers were infected. So they come into the hotel for just 1 room. So everyone needs to grab the handle. They have they were 60, and they have 4 showers and about the same amount of toilets. So it's pretty scary because you don't know where you're going to encounter this coronavirus. Could be with the person that I'm talking to, but I have no other option. So we have been listening to all kinds of these examples. And what we did is we noticed that workers were losing money for different reasons. The kids staying at home. A person, instead of paying $100, were paying $250 or even $300 because they need to pay for more children. So that's another reason. And what we did is we start a distribution of food. And in 6 different cities, Delano, Madera, Oxnard, Salinas, Santa Rosa, we distribute more than 250,000 hot meals made by the local restaurants, especially for farm workers. So together with COVID, other issues, I think we're to focus in COVID-19, but pesticides and not cleaning bathrooms and other working conditions have been not getting better, it's getting worse. I have seen, and I've been taking pictures of work. I can see the sign where it says do not enter, and there's workers working at a few meters close to the sign. So it's something, and I think it's good. But a week ago, someone was talking to me about new law into effect in California, and the person told me, "What do you think about this new law?" Was a reporter, and I told her, "I think the laws are good, but the laws is very rarely to be enforced. The law is good, but we need enforcers." And it's the case of the company not paying the workers who get COVID-19, although the governor signed that they need to pay about 2 weeks. So what we have seen is, we have seen also very responsible companies. And I can give examples real quick. They modified the transportation. They encouraged the workers to, instead of riding the bus, all of them, good amount of them were taking their cars. And they facilitate this specific issue. The sanitation, they hire extra workers just to do that, to make sure bathrooms and machines and everything will get sanitized after they finish for the day. Masks, gloves, and other companies modifying also the lunchrooms. If they were bringing 100 workers to take their lunches at 12, they started distributed between 11, 11:30, 12, 12:30, groups, smaller groups. And the other issue that I have seen is working the companies together with the workers and us. We were able in companies not to mix the crews. So a group of 30 basically was the commitment of the workers. Although we finish late, we don't want any help us, because we don't want it to get in touch with other workers. So those are some of the very concrete examples that I have seen with companies that are doing the right thing. And like I said, there's others who don't even, they continue not even cleaning the bathrooms. So they're not concerned about workers wearing face masks, washing their hands. It's a joke for them. I will finish saying that although that we have a lot of cases here in Monterrey County and part of Santa Cruz, I think the county is handling better. And I think a part of the issues is that the unions here, we have members on the contract, and we enforce with our members that the companies comply with the basic requirements of face covering, sanitations, and other issues. And I see that that's putting pressure to other companies to do the same. So with that, I'm stopping there.
Thank you so much, Lauro. Appreciate it. I think we'll go to our next. I do have some questions, but I anticipate there'll be questions for both you and our next panelist, so I'll have him present first. Pete Monterino, are you here?
Yes, I am.
Great. Go ahead. Would love to hear from you.
Well, I want to thank Chairwoman Hasid for the invitation. I never thought I was going to be invited to talk on behalf of the ALRB, kind of. I've been doing this for quite a while, and for a number of years, I was probably dead set to criticize more of the ALRB than and give it kudos. You know, I was going to be talking about different items, including cannabis and the enforcement of the regs with regards to cannabis and stuff. But since we're talking about COVID-19, you know, I'll kind of confine myself to that. We had a conversation, I'm not sure, a week and a half ago, and part of the conversation is that I'm glad that to hear from Don Villarejo from, you know, his organization, and Líderes Campesinas. And what it's telling me is that there's more people being more involved, not because COVID-19, but because they've been involved in farm worker issues for many years. One of the things, though, I do have to say about Monterey County, though, since I'm here in Monterey County, is that, yeah, they're very good about putting together the information, and the local media announces every day the changes that are going on in the Tri-County area, as we call it. One of the things, though, is that where I had a big problem with the county medical officer here in Monterey County was that when Governor Newsom announced that they were going to mandate the face coverings, we had one of the employers that we have under contract, and that employer was told that they were going to require not only the farm workers that they have under there, but also the workforce that we represent, which is about a couple hundred people. And so I told that employer was, you're going to require them as of Monday morning to wear face masks or coverings. Are you going to provide them? And they said no. And so the conversation between I and the medical officer in the county was, how can you put out an order, whether it's from Newsom or anybody else, for farm workers or the ag workers to be required to wear them, and not tell that employer, you must provide those face masks or those coverings. And what that employer ended up, as a gesture of goodwill, ended up giving bandanas. And everybody understands that bandanas is probably the least effective, in trying to corral the coronavirus or COVID-19. And I can't, because it's not mandated, it's not by law, I can't force that employer to provide, another type of mask. And so that's the only thing that I had to say about the Monterey County situation. I mean, they are on top of things. At the beginning, they were not giving out any information. But I still say that if you're a state or federal agency and you're going to mandate something on a group of workers, you have to know that these workers will probably not be able to afford the face coverings. And so you have to mandate also that the employer provide these face coverings. I have to say that all the other employers that we deal with, whether they're farm worker membership or ag and salad process, do provide the mask, and they're doing a good job about it. But if you come to Monterey County and you're going to look at the different operations as you drive through the fields here, and some of them have made some adjustments on the mechanical equipment that they have out there, where there's harvesting crews behind them, and they put up the plexiglass partitions and stuff. So they made some adjustments. But a larger portion of the employers, through labor contractors as they may be, or others, have not made those adjustments. And they're still continuing to require that these employees work right next to each other. And I'm talking about, they're only about, I think it's 1.5 feet away, because 2 foot furrows or rows. So they're still doing that. And the big thing with me and what's going on here in California, because you see them all over, is the California US vans that you see out there on the road. When you're coming up to ag, whether it's here, Central Valley, or whatever it is, I'm assuming that they get some kind of deal from the state of California to provide these vans. Well, these vans carry 15 people. And 15 people are just smashed in there. And it becomes a problem, because all it takes is one person that's infected to infect the other 15 people that are going to go back to their homes, and maybe infect their kids or their mom, their dad, and whoever else in the family. And then that comes to another point that you guys were talking about earlier, is that things have not changed so much here in Monterey County that there's still 2 or 3 families per home, 2 or 3 families per apartment because of the expense. And the wages that they receive are just something that not one, a single family cannot afford an apartment here in Salinas, let alone Santa Cruz, or even in San Benito is becoming very expensive because the people from the Bay Area, especially now, with all those techies out there with millions of dollars selling their homes over there, that a 3-bedroom, 2-bath regular home over there is like 5 million or 3 million in the Bay Area. Now they're coming to Hollister and Monterey County and know with those $3 or $4 million, they can purchase a mansion and work out of their homes. A lot of these tech companies now are gonna let these employees work out of their homes. But I think it's essential for the ALRB, like I said, we talked about it, to work together with not only statewide nonprofit organizations like where Don Villarejo is, the Coalition Immigrant, and then Líderes Campesinas, or anybody else. I just saw a little take from the gentleman that was there on his organization, and I think it's great. I think that the ALRB, together with interagency cooperation with the Labor Commissioner, Cal OSHA, and others, is essential. Not only because of COVID, but anything else that related to the farm workers, and that's what you deal with, is under the ALRB. With us and the United Farm Workers and the Teamsters, we deal with 2 agencies, which is the ALRB and the NLRB, and dealing with ag because of the salad plants and things like that. But with COVID, I also like the idea, like there's organizations like Cause that deal specifically with the farm worker, ag workers and stuff on social services and other services. And I think it's very important that the farm worker community, I mean, there's only 800 or 900,000 of them here in the state of California. And so I think it's very important that these individuals have information as to what the ALRB does and what services you provide. And I think we talked last time, and if it's something that you don't do, that you're willing to kind of point them in the right direction, which is the Labor Commissioner, Cal OSHA. But I think it's this bill that's coming up, AB 685 with Reyes, is going to be a game changer, because it's actually going to provide information to not only the public and the nonprofit organizations, but also to workers, because workers are asking, did anybody get infected today? And workers find out a little bit later, because they figured it out that person is missing and hasn't come to work for a while. And then, or they talk to the family members and things like that. But I think it's very important for workers to be informed as to somebody within their crew or coworkers is infected, because they're going to have to make an informed decision about whether they're going to continue working for that employer. And yeah, there's things haven't changed that much. There's always retaliation for something, especially when it comes to labor contractors. Now they call them real fancy names like temp agency. There's retaliation. There was a PBS documentary that was done here recently. Starts off with a farm worker within Greenfield, California, which is here in Monterey County, and it's talking about COVID-19 and the exposure and the effects and things. It's a great documentary, but it also talks about one of the employers that we have here in Salinas that works out of San Juan Bautista, and somebody unknowing to the HR director filmed them with their phone and caught it and said, saying that he was going to terminate all those people if they didn't go back to work, and he didn't want to give them information because that's what they were afraid of, is there was people that were infected, that was coworkers. They wanted to find out if it's true or not. So he was going to fire all those people. There was about 60 people that were refusing to go back to work until they got information. So there is retaliation on behalf of some of the employers here. And Hugo was talking about the H-2A workers. This is a part of the worker population that we haven't dealt with regards to COVID or anything else. If I wanted to organize a workforce that was half H-2A workers and the other half local workers, the local workers probably have more issues because some of them are undocumented. The H-2A workers are contracted, but yet they also have needs. And what happens when we try to organize an H-2A worker? What is going to be the ALRB's position? Because these individuals that are contracted are only going to be here for a year, maximum 2 years, if the employer gets his way. And then also these individuals, and here where I sit right now in my office, about 50 feet away here is a hotel next to me, and it's packed with H-2A workers, and they have 7 to 10 workers per room. And so one of the workers in the H-2A is infected. What does he going to do? Who does he go to? Do they hide him? Do they call the Mexican consulate and that employer say, we no longer need this person, so we need to ship him back to Mexico and he's sick? Or is he going to affect his coworkers, or is he going to be allowed to be pulled out of this hotel and sent to the housing that Monterey County or the Growers Shippers Association is saying that they have this housing for these people that are quarantined? Even though we have membership and they've been infected, both for the farm workers that I represent and the non-farm workers in ag, such as the salad plants, we in the union have become the enforcers of what's required by law. And I'm talking about the 80 hours that we're talking about that people are aware or not aware of. My job is turned into from enforcing a labor contract that was negotiated with that employer to enforcing something that's state law with the COVID, and make sure that these individuals get paid, make sure that these individuals don't lose their job, don't lose any seniority, that the employer basically, one that does the right thing, the other that they do what the contract requires. And that's part of our job. And it's kind of awkward, the things that we've had to switch over to in order to service the membership that we do have. But even then, even these employers that are union, that have a contract, even them, they're trying to hide the fact that somebody was infected because they don't want the bad publicity. It's almost like the publicity of a salad recall kind of thing, where they don't want you to know who it is. And it's a big no-no here, man, to say that it was employer A or employer B, because they're going to lose profitability. And somebody at the beginning of this, the panels and stuff, they were having the conversations. The impact on farm workers has been, the economic loss has been pretty great. And I hear it because I'm in negotiations yesterday, and this employer that I represent is telling me that he lost currently a little over 2 million packages that he had at the same time last year. And that translates into jobs. And so the farm worker community has lost it. And you can see it when you're going out to the fields here. And instead of watching farm workers still working at 5:30, 6, 7 o'clock at night, their day is finishing up at 1 o'clock or 11 a.m. or 2 p.m. So they're losing hours, they're losing income. And so it makes it even worse, when it comes to the living conditions that these employees have to go through. So I guess my take here is, like I say, I was going to talk about the cannabis and access and things that we've had some problems with because of cannabis. And but I just think that the key here is collaboration on behalf of all your nonprofit agencies, state agencies, even the unions themselves, because we all have one goal in mind, and that's the health of the farm worker. Me a little bit more because I want better wages and working conditions and benefits, and then the other agencies, they just want to make sure that these farm workers that don't have a union or representation, that they don't lose their employment, and that they don't get sick. And I know the employer, there's a lot of them out there that want to be able to know that their workers aren't sick because they need them, and they're skilled workers. A lot of people think that farm workers are unskilled jobs, and I would challenge anybody to try to go out there and cut lettuce, and you probably get fired within the first 5 minutes. And I remember, to us it was funnier and heck. We had an Anglo newspaper reporter about 20 years ago, and she wanted to do a story on the farm workers, and she wanted to see if she can get a job, and she put herself in front of the buses there at 4 o'clock in the morning in front of McDonald's. And when she started asking the labor contractor, the bus driver, do you guys, what time is your rest period? And do I get gloves and all that stuff? They wouldn't let her on the bus, because you're asking too many questions. And so right away, they didn't even give her a job. But I also know some people that have gone out there and they have worked as a farm worker, and they would never do it again, because it's that type of job that it used to pay pretty good. Now it's all hourly, and now it's a lot of contracted workers from Mexico that's under the H-2A programs and stuff, and that they're trying to change also. But there's a lot of effect here in Monterey County and throughout the Central Valley. Is supposed to be a hot spot with the workers. About 28% of the farm workers here in this area, or ag workers, are being affected. The infections that we have so far, according to Monterey County and the local media. So I think I'm gonna kind of leave it at that. And I'm not sure if anybody has any questions about this.
Thank you both so much. I do have questions. I want to note we're running, because of the myriad of issues that are being addressed, and it's really fascinating. We are running a little bit long, so I do have some questions, and we do have time for public comment and questions, but I'd like us to hopefully move on in the next 10 to 15 minutes, because I know one of our panelists is time limited. I had a couple of questions, actually. I'm really heartened, Lauro, to hear your comments that you are seeing some best practices, particularly in transportation, as well as the plexiglass. So, well, I know that may not be widespread, or not everyone, I should say. I am heartened to hear that there is some of that going on. I have a question for both of you. Pete, you mentioned you're having to enforce state laws, and I want to be mindful to ask that you not discuss any charges that you may have filed with our organization, the ALRB, because that may be something that we are reviewing. But if you could speak generally about how you've helped workers if they've had questions about sick leave and how you've been able to maybe help get them sick leave. What have either UFW or UFCW, what experiences have you had in that regard?
Well, I think I went to do my. I went to take my own test last week, and just like the first day, and I talked to the persons on the place taking the test. Because we were doing the food distribution and dealing with a lot of people. and I was talking to someone who gave positive, and I was talking to him. So when I explained, she goes, well, you know what? Yeah, we can do the test for you today. But sometimes it takes 2 weeks for anybody to have the test. That's just to have the test, and then you need to wait like between 4 to 7 days. So that's 3 weeks. And people can, possible people is not with COVID-19, they just have a regular cold. So at least what we try to do right away is tell the workers, have yourself go and do the test, so you know if you're infected or not. If we can improve these for people to do it like in the first day or second day and have the results quicker, then instead of people who is not with COVID-19, instead of wait 3 weeks, the end of the waiting can be 4 to 5 days. So that's, for me, that's one of the big issues that workers and companies are confronting, because in some industries, they don't have enough workers. And in others, could be the case. So for me, that's, like I said, that's one of the biggest issues that workers are confronting. And the other, when people get positive, they go home, and like Pete mentioned, the living condition, there's a lot of people living in the house. So it's very hard not to infect other members or people who live with them. So for me, those are very important issues, and that's why people get infected.
Pete, do you have any comments? Have you been able to help workers get sick leave, or have you seen that any of your members have been able to take some of the paid sick leave provided under the CARES Act or Governor Newsom's executive order?
Yes, we have. I mean, we've had quite a few people that we need to make sure that they got that paid the 80 hours, but then there's some people that weren't able to return back to work for a week or 2, 3 weeks. We got them leave of absences either through our contract, through FMLA, or some of the other state mandated or federal mandated laws and stuff. And I've gone from people just getting sick to actually, one of our members dying, on having to talk to his daughter about that. And this is the problem. Of course, it's brand new, and all I could tell her is that they were going to have to contact an attorney, because I know the state of California said that if you have the COVID-19, it's basically considered workman's comp. That's what Governor Newsom and the state of California said. So we're treating it as such, and then referring them to an attorney. But I know all this is, like I told, this is all new and new territory legally, and whether you can sue somebody, not sue somebody, and what's going to happen. But I went from that to making sure that somebody is quarantined, and then that they're tested before they come back to work, and allowed back to work because of the rest of the membership.
Thank you. I'm so sorry to hear about your member that passed away. That's very tragic. Do any of my other board colleagues have questions for either of our panelists? Okay. Do any members of the public have questions for either of our panelists? Okay, thank you. I just want to thank both of you so much for taking the time and for all the work that you're doing. Really appreciate you presenting this information and sharing this here. I've been taking notes. I do want to note that we have been discussing in that internal work group I mentioned the issue around transportation. I will say the focus of our initial conversations have been around improving outreach materials, having them be more understandable, more widespread, and then also working on supporting the Housing for the Harvest initiative, but the transportation issue has come up. So I did take some notes, Pete, and I may be following up with you on some of those specific issues that you raised. I really appreciate you bringing that up.
Thank you.
Thank you both.
All right. We'll now go on to our next panel, which is our employer representatives. Please join me in welcoming Brian Little with the California Farm Bureau Federation. He's the Director of Labor Affairs for the Farm Bureau, and then Matthew Allen, the Director of Government Affairs for the Western Growers Association. Brian, I understand you do have a time constraint, so would you like to present first?
Thank you. That would be very helpful, and I appreciate your accommodation on that. I've been on for about an hour, and I have been encouraged to hear that there are a lot of efforts going on to try to do everything possible to try to help our industry and our workforce work our way through this current situation. This is going to be and has been very difficult for everyone involved. When all this started back in March, I think it kind of caught everybody by surprise, and we were in a difficult spot where we had facilities and machinery and housing and other kinds of facilities that are necessary to do agricultural production in California that just were not set up to accommodate social distancing. I think we know fairly early on that there weren't enough masks or any kind of face coverings to go around, shortages of hand sanitizers and other types of supplies that just made things very difficult to try to get ahead of it. Now that we're getting into the harvest season, my anecdotal observation is that some of those shortages are starting to ease off, and I think that our employers have done a lot of work in doing things like providing additional space for shade during hot weather so that we can do social distancing. People are on meal breaks or rest periods, modifying machinery and facilities to allow for social distancing, providing additional hand washing stations. I spent an hour on the phone earlier today with a large agricultural producer in the valley, just trying to work through how he should go about providing water in a way that's going to be as safe as possible for his workers. And we talked through all those issues, and I'm really not sure exactly what he's decided he's going to do, but he's aware that there are, regardless of what he chooses to do, there are going to be issues that are going to have to be worked through as a result of that. So all of this has been, I think, difficult for everyone involved. When all this started, about 40% of our industry went to, our production went to restaurants and food service. And of course, all that stopped very quickly and very precipitously. And that's not a supply chain issue that you can resolve quickly. Most people going to the grocery store aren't interested in buying a 20-pound bag of lettuce or a 10-pound block of cheddar cheese. And so when you already have that stuff in the pipeline, you can't just shift it from going to food service to going to retail. It just doesn't work. I think we've seen, noted some people talked a little bit about, I think it was Pete, talked a little bit about how workers seem to be having shorter days. And I think that some of the employment numbers I've seen have reflected that as well. That we have fewer people employed, and we're probably, and I'm pretty confident that we're going to wind up producing less. Some of the economic information we've seen indicate that what in 2019 was a $45 billion industry is going to wind up being about $8.3 billion smaller in 2020 than it was in 2019. So that's going to present challenges for everyone involved. But since all this began, I know that I've spent an enormous amount of time and energy, and Farm Bureau has too, in working to get information out to our members so that they understood as best as we could help them understand what was going on, what they needed to do to protect their workforce and to be able to continue producing, because we're an industry of about 800,000 people working to feed the other 37 million of us in California. If any of you, I've met some of you, but I haven't met all of you. If any of you have met me, you could tell from looking at me that I don't miss many meals and I like to eat. I think we all like to eat. And so to the extent that we are an essential industry, we want to continue to farm and we want to protect our labor force. We were pushing out so much information for a little while there in March and April and May that I was actually getting emails back from people saying, Brian, can you send me a fewer emails because I'm having a hard time keeping up with all of it. My response was usually, I'd like to, but there's too much going on that you need to know about that I need to be able to tell you about for me to send you less email than I'm sending you. And then the other piece of this has been that I've been answering on average 5 to 10 phone calls a day from agricultural employers, just trying to understand the safety issues around COVID-19, what the latest thinking was from CDC and CDPH and CDFA and the other, and not to mention Cal OSHA, the Department of Industrial Relations, and the issues that they try to deal with, and just try to give them as much guidance as I can about how to work through all of this stuff. We've encountered a lot of problems with situations where sometimes Cal OSHA wants you to do something, and sometimes the local health department wants you to do something a little bit different. And then CDC is kind of out there kind of talking about things a little bit differently and putting things in different ways that have caused a great deal of confusion. And we've been put in a sometimes uncomfortable position of trying to help them sort through all that and try to figure out. I think it's been largely an exercise in trying to help them figure out what they need to focus on, and not necessarily the exclusion of anything else, but just a question of priorities. Farm Bureau, in addition to just the efforts that I've made and the efforts our county farm bureaus have been making in working with local agencies and local health departments to try to work through some of these issues as they come up, Farm Bureau spent about $100,000 on 2 flights of radio ads, one in April and one in July, public service announcements and related paid media to educate our workforce about the sanitation and personal distancing and other issues related to COVID-19 back in April. And then when we did the second flight in July, to remind them that all those things that you've been doing for all of these months, you need to do those when you're not working as well as when you are working. And by the way, you might want to reconsider going to a party this weekend. Because in July, it started to emerge that we thought we were starting to see a greater number of greater incidents of transmission that were occurring in social situations. And so we tried to be responsive to that and tried to get out there with information about that. We've also been surveying our members. We surveyed them once in April and again in August. That survey is still out there to our membership, trying to understand what kind of challenges agricultural employers are facing and farmers in general are facing. And the answers have been interesting. A lot of people have had some reduced activity. They've had reduced employment. They haven't been able to employ as many people as they normally would. They've also had difficulty because of the inability to source personal protective equipment. They've had some inability to be able to do the things they would normally do. That was early on in the season, and a lot of that had to do with preparatory and cultivation activity that they were not able to do because of the unavailability of certain kinds of personal protective equipment. We're now getting into even perhaps more interesting and harrowing and perilous situation where the wildfire smoke regulation requires agricultural employers, well, all outdoor employers really, to provide N95 respirators when the AQI exceeds 150 as a result of the presence of wildfire smoke and PM 2.5. And I think we all know right now that N95 respirators are very difficult to come by. And trying to get the kinds of numbers of N95 respirators you might need to supply a labor force of 400,000 or 500,000 people, because you don't know where the wildfire is going to occur. It probably won't occur everywhere at the same time. but everybody needs to be ready for it in the event that it does occur where they are. So that's going to create a lot of demand for N95 respirators that that the supply chain right now today could not satisfy. So we have a lot of concerns about how that's all going to unfold going forward as well, because nobody wants to take N95 respirators away from critical frontline healthcare workers. That's the last thing we would want to do. But another thing that a lot of effort has gone into also, there's some conversation earlier about furnishing face coverings. I think a lot of face coverings have been furnished through a lot of different sources, including employers. So there's a lot of that happening, and I think it's important to keep in mind that face coverings aren't just something that you're supposed to be using at work. We're all supposed to be using them all the time whenever we're outside our home or away from the people that are in our household on a day-to-day basis. So there's been a great deal going on. I think, based on the information that I get from agricultural employers that I talk to every day, I think they're making a huge effort to try to protect their labor force, to try to provide them with what they need to protect themselves, and with training and information, and providing them with workplaces that aren't a hazard related to COVID-19, and to try to do everything they can, because at the end of the day, if we don't have a labor force, we can't produce food for all the rest of us to eat. So I think there's a recognition that because we're an essential infrastructure industry, that we need to be mindful of making sure that we protect our workforce to the greatest extent that we possibly can. So I don't know that I need to say anything further than that, but perhaps at this point defer to my colleague, Matthew, I think he's still on, and let him say his piece. So thank you.
Hi, Matthew. Welcome.
All right. Good afternoon, I guess, to everyone. And in the interest of time, I know we're running a little long in the meeting. I'll attempt to keep my comments brief, but I would definitely reiterate everything that Brian said. I mean, our industry is absolutely an essential industry. Without food, we can't survive, and our labor force is absolutely critical for our industry, and also because of the human element that's involved. This is really important to all of the Western Growers membership, is prevention of COVID-19 and how to best keep our workforce safe. Back in March and early April, of course, as the shutdown happened, as Brian and others have mentioned, we had immediate shutdown of food service and schools. And so we had a lot of product that was lost that had to get rotated back down into the fields. And we had to scurry quickly to make sure that we could redo contracts to get food volume placed in the retail and other consumer markets. That all has an impact on the workforce, the growers, obviously the economy and local economies. Upwards of $8 billion are the estimates, and we would expect that those numbers will continue to see some negative impacts in the weeks and months ahead. But we have been extraordinarily proud of our workforce and our growers in keeping a focus on not just what we have to do today, but what does next week and next month look like, and what do we need to be doing to prepare for that. So I want to cover a couple of topic areas, and really when it comes to sort of what we're doing at the field level on COVID-19 prevention. And there's sort of 5 key areas that our growers are really focusing in on sort of on a daily basis. And they kind of range in level of sort of what's easier all the way up to what tends to be more difficult or more challenging. And the first is, immediately disinfecting all the common surfaces. So, that's something that we were already doing because of food safety protocols, but now we're doing it even more often throughout the day. A lot of training going on to all of the workforce about the necessity for this and standards that are in place for additional surface cleansing. Hand washing, another great example. That's something that we continue to train on. It's part of our already food safety awareness training, but now we're even doubling down on that and have been since March. So all employees are washing hands not only more often throughout the day, but for longer periods of time. So that's also very helpful. now getting more difficult, and that's physical distancing. As Brian mentioned, there are certain operations that happen in the field that make it more difficult to maintain the 6-foot spacing that's recommended. So our growers are working through to make sure that everything that can reasonably be done to maintain that is actually being done. If it's requiring sort of plexiglass into some of the machinery to keep some spacing between people, they're doing that. Another good example is that we have in harvesting, instead of having workers in every row in the crop, we'll space people out so they may be in every second or third row. It's difficult on productivity, but it maintains physical distancing, and so our growers are doing that as well. Face coverings, that's just standard. As Brian mentioned, everybody is wearing face coverings. There's reminders throughout the day, the morning briefs to make sure that in addition to the hand washing, all the sanitization procedures, that people wear their face coverings. Face coverings is, I think, becoming a little bit less of an issue because we're seeing a little bit more stability in the supply of PPE. But early on, that was definitely a critical issue for our industry. And we engaged early on with Department of Food and Ag, Cal OSHA, the governor's office, in trying to find additional ways to maintain a supply for our industry as an essential category. We really view our workforce, we're really right in line with the healthcare industry. Face coverings and PPE equipment are absolutely critical. And to that end, back in late June, we announced, along with the California Manufacturers and Technology Association, a partnership with the state of California on a portal called the Safely Making California portal that links manufacturers of PPE equipment, so like face coverings, to employer and workforce groups, so that they can access sort of the general supply of PPE equipment. And that is actually getting off the ground and running, really being led by CMTA with Western Growers and a handful of other organizations participating in that partnership. So we're proud to be doing that and look forward to doing even more. One of the things that I think others have alluded to in the meeting, it's a much more difficult area to sort of manage, is what happens outside of the workplace. We definitely encourage our employees and provide information to them about best practices, when you're not at work. And we have employers that will provide a flyer to their workforce or conduct that as part of their tailgate briefings. But what is happening outside of work is really just as important as what happens at work when it comes to preventing COVID-19. I would say in the last couple of weeks, one of the main focus areas that we've had is on testing, because we continue to hear that it's difficult to get testing done in a rapid manner with rapid turnaround timeframes in the Valley and other areas in the state. And we continue to hear cases taking 8 to 12 days turnaround time to get a test result back. And right now for our industry, that's not acceptable for us. We want to make sure that we're able to provide information to the worker about test results in a quick manner. And also for the employer to be able to then deal with that situation and then kick into place quarantining and also taking care of paid sick leave and any other things that need to be handled on the employer end. Brian mentioned wildfire smoke issues, and we continue to push on Cal OSHA and other agencies to make sure that we're keeping sort of an open mind to flexibility when it comes to other regulations that are going into effect, given that there's so much pressure on PPE and N95 respirators, that in other situations, we should be looking to other types of protection that would be helpful, because anything is better than 0% protection. And even though something might not be quite as effective as an N95, we should be keeping an open eye to other types of technologies that might work for our industry. So that's kind of a very, very brief update from kind of what we're seeing at Western Growers, and I'm definitely open to any questions anybody has.
Thank you. I really appreciate both of you, especially Brian. I know we initially thought this might go on a little bit earlier, so I just want to thank you both for also providing so much education to your members and helping them ensure that their workforce is safe, and also sharing some of the challenges. that you shared in terms of how it's impacted the economy of the industry in terms of loss of certain demand and the impact that has had. I am going to actually hold questions because we do have some other panelists on our next panel that that do have some other time commitments. So Brian, I know you said it to go. Matthew, if you're able to stay on maybe for the end, that'd be great. But if not, I understand. I just really thank you both for your time and for the work that you're doing to help support your members, protect workers. So thank you. Okay. So our next panel, last but certainly not least, we have representatives from several community-based organizations. So please join me in welcoming Estela Cisneros, who's the directing attorney for the California Rural Legal Assistance. I'll note that this was erroneously listed as the CRLA Foundation. CRLA Foundation and CRLA are two separate organizations, and Estela is part of CRLA, so I apologize for that error. We also have Oralia Maceda, the co-executive director for Centro Binacional para el Desarrollo Indígena Oaxaca. I apologize, I'm not able to pronounce. Oaxaca. We have Arina de Beracuya from the public relations manager for Líderes Campesinas, and Arsenio Lopez, the executive director for the Mixteco Indígena Community Organizing Project, also known as MICOP. Estela, would you like to go first?
Yes, definitely. Thank you so much. Can you hear me okay?
I can, thank you.
Okay, great. Thanks so much. Well, good afternoon to everyone. Thank you so much for having me. I'm really pleased to be able to address the ALRB as well as the remaining members of the community and everybody else who's on the line. My name is Estela Cisneros. I'm the legal director of the Agricultural Worker Program at California Rural Legal Assistance, Inc. CRLA is a nonprofit legal aid organization created in 1966 to represent California's low-income rural communities and their residents, including agricultural workers. So the program that I work for, the program that I manage, represents agricultural workers exclusively. So that's, you know, as all of you, I'm sure are familiar with, includes field workers, dairy, as well as people who work in dairies, packing houses, nurseries, and meat processing facilities. And we represent them in a variety of legal matters, including employment law and issues related to workplace health and safety. AWP, which is, again, the Agricultural Worker Program, has offices in Stockton, Fresno, Salinas, Oxnard, and Coachella. However, the organization also serves a lot of non-farm worker rural residents in a variety of legal issues, such as housing, education, employment, health, and immigration in the 17 offices we have statewide. And then we also serve specific populations, such as the LGBTQ+ community and the Mexican indigenous community through 2 specialized programs. I would like to start by first focusing on the issues our farm worker client communities have raised with us throughout the state with respect to COVID-19. So definitely the biggest concern that we have heard and continue to hear is the catch-22 that they find themselves in with respect to their jobs. Should they, with their respect to their jobs as essential workers, you know, should they put themselves or others at risk of contracting COVID-19 or put food on the table for their own families? What this has demonstrated to us is that workers continue to simply not feel or believe that their employer is doing everything it can to ensure they can work as safely as possible. This has been true since the beginning of the pandemic and continues to be the case with respect to all of the workers that call all of the farm workers that call our office. Employers in all the areas that we serve have failed to do a variety of things, some of which have already been discussed that I won't repeat, but just very briefly, that I won't repeat in great detail, but I'll just briefly overview establishing and following social distance measures, especially in the packing and meat processing industries. We still continue to hear of a lot of cases of workers in these industries that continue to work shoulder to shoulder with very little or no personal protective equipment or equipment used to protect others, as the PPE, it's commonly, as all of you know, referred to as PPE, but it doesn't actually protect the wearer, it protects the other individuals. And that also applies to people in packing houses, so a variety of packing industries. We've also heard a lot, we continue to hear complaints from workers there. The provision of equipment, encouraging employees to stay home if they feel sick or if someone in their home is suspected of having COVID. This isn't really something that a lot of the workers that we've discussed, we've been into contact with, have heard from their employer, which we feel is very important, as reassurance that if they were to take sick leave, right, they're going to have their job back. They're going to be able to return to work once they are well enough to return. Also, you know, practical and necessary distancing measures like staggering meal and lunch breaks, staggering start shift times, providing more hand washing facilities. These things are not being done. Critically, providing this information in languages our clients speak, including Mexican indigenous languages, such as Triquín Mixteco. So those are some of the things that we continue to hear from workers that their employers are not implementing or following. And then, of course, the second part of that is that if they do fall ill or suspect that they are ill, or somebody in their household is ill or is suspected of being ill, there's a lot of fear that they'll lose their jobs. They won't be able to go back to work because of retaliation that they fear or have actually experienced from their employer. Something that has been touched on already briefly that we've also been hearing about is the issue of H-2A workers. Their entire work and home situation is provided by the employer. So there's really great opportunity there for the spread of COVID-19 amongst people that are being transported in the same vehicle or that are housed together in the same hotel or other such close quarters. As I believe all of you are aware that I'm not sure has been discussed yet, is the higher instances of COVID-19 that are now being found in the Latino community in a larger proportion than their proportion of the population. People are starting to kind of theorize about the reasoning for that. You know, we posit that it's, you know, a significant proportion of the frontline low-wage work, right, has continued despite the pandemic, including agriculture and production work, is comprised of the Latino community, the Latino immigrant community. So for us, really, we've been working to help to help employees kind of address the health and safety concerns that they have in the workplace for many years. And so before COVID, we saw many instances of the failure to provide, you know, water, shade, hand washing facilities. And so, you know, we wouldn't expect that to be any different in the COVID-19 world that we live in now. There were a couple of kind of questions that were suggested to us. I won't take up as much time on that, but I do think it is helpful to know sort of what CRLA is doing, because in a lot of areas we are the only or one of the very few legal service providers. In, you know, many parts of California where a lot of farm workers live. So we've really had to shift from the pre-COVID legal needs to the post-COVID legal needs. There's a lot of similarities, but there has been sort of heightened or sort of kind of more specific kind of knowledge and legal issues that we've had to tackle. So, you know, a large one, of course, is the moratorium that's going to expire on evictions this Friday. We expect a huge flood of such cases and such legal need to happen after people can once again be evicted. A lot of our clients, of course, also have education needs or their children. A lot of parents are struggling, especially if they don't speak English, especially if English is their second language, with setting up, setting up an environment in their home where their child can learn remotely. And even as, you know, basic as not having stable internet, right? And then, of course, then there's the secondary issue of having to work through lesson plans and sort of other, kind of information that their child is supposed to obtain when the parents themselves may not have that skill set. And then, of course, there's also children with special needs, right, that may be having a lot of difficulty being out of school, and with the additional resources that are provided at school through special education programs. In terms of employment, a lot of people, and something that we've pivoted to, that a lot of offices have been doing unemployment insurance assistance with claims, but now a lot more offices throughout the state are doing that, given the high need that there is with so many people who are laid off. Being able to access unemployment insurance, as well as kind of obtaining information on what their rights are in the workplace with either the federal extended sick leave, the California sick leave, the sort of extended sick leave for employers above 500. That was provided by Governor Newsom for workers who work in the food context. And then finally, in health, of course, there's a lot of concern from people about how to seek medical treatment, where to obtain it if they are infected or if they believe that they're infected. We have struggled a lot actually with being able to connect workers and other client communities with healthcare centers. In terms of getting tested, that's something that I've heard other panelists address. That's still a huge need, especially in the rural parts of the state. There's still a lot of people that are struggling just to figure out where to get tested. And then, of course, then there's the 2 weeks that you have to wait to even get the results. And in the meantime, you're supposed to self-isolate. But for a lot of families, that's very hard because they don't have, savings and et cetera, or if they're not able to access unemployment insurance, if they're not eligible for unemployment insurance. That's also another concern for families. So what we've done, like I said before, is we've pivoted to kind of addressing a lot of these legal needs that we were already doing, but it's kind of an emphasis on that, as well as continuing to deal with the prior legal needs, right, that all of our client communities served. That all of our client communities had prior to COVID. It's definitely increased the amount of legal needs that people have. We continue to do our best. Despite working from home, all of us are working from home, but we continue to provide legal services to clients. So, to the extent that anybody has any need or any, I'm always trying to put a plug in for referrals to our offices statewide. And then finally, in terms of resources to address the needs, it's definitely enforcement. Enforcement by a variety of agencies, of a variety of protocols and recommendations. We have, worked with Cal OSHA, we've worked with local county ag commissioners, we've worked with local public health departments. The Monterey County sort of coalition with growers and, CRLA, organizations like CRLA and, Cal OSHA and the public health department. That's definitely a model. Nothing is perfect, of course. I know that there's been concerns raised about the issues that advocates there have had, but it's definitely, to my knowledge, one of the very few, if not the only one in the state that kind of has that coalition work that they're doing. So it's definitely something that I would want to see in other counties, because a lot of other counties are simply struggling to give the necessary information outright to the community. There's not a lot of transparency or clarity on what protocols local county health departments are taking to ensure that we contain the spread of COVID-19 if possible. So contact tracing, as well as gathering information by occupation. To my understanding, that is still something that a lot of public health departments are struggling with, which is critical to really kind of, making sure that we try to contain it to the extent possible. But also, of course, the work that we do with Cal OSHA, the complaints that are filed, the follow through, that's definitely something that is critical to addressing some of the concerns that our client communities have had. And then finally, of course, is the retaliation piece. So that's where some of the other agencies come in terms of enforcing those rights, not just on the state level, but also on the federal level. So I won't take up any more time. Thank you so much for inviting me. And if I could answer any questions, I'd be happy to.
Thank you so much, Stella. I know some of our, the other panelists also have time commitments, so we're gonna hear each of the panelists, then open it up for questions from board members as well as the public comment. I'll note I'm seeing some questions in the chat for public comment, and I ask that when we do open it up for public comment and questions at the end, that you reiterate those questions verbally over the Zoom for those that have asked questions in the chat that have not spoken up yet. And then I am seeing some questions about whether this recording will be shared. We are trying to do that. We also are trying to share the recording from the last meeting and had some technical challenges, but we are working on doing that, and we'll share more information once we're able to get that going. So with that, thank you, Estella. Please hold on, because I do have some questions. Irina, I know you had a timing issue, so maybe you can go next.
Hi. Yes, I can go next.
And
Thank
then,
you.
Sorry to interrupt or talk over you. If you have a presentation that you'd like to share, please hit share screen on your screen for that. And go ahead, Irina.
All right, let's see here. Thank you. Okay, present. Do you see? Yes, right?
I saw, now it looks like it's loading. So
Okay.
I'll just give it.
So I'll just start with, my name is Irene, or Irene. I'm with Líderes Campesinas. I'm the Public Relations Communications Manager. During this time of COVID-19, I've sort of been overseeing our work statewide in response to COVID-19 in relation to the farm workers. Líderes Campesinas, as you see here, the mission is to strengthen the leadership of farm worker women and youth so that they can be agents of economic, social, and political change and ensure their human rights. This hasn't proven to be, this has proven to be extremely true and crucial during this time of a pandemic and a crisis. This strong network of women farm worker leaders is really the backbone of the work that we do. And so this is a statewide movement. We have chapters as far south as Coachella and up north to Sonoma, Napa, and all in between. And right now, during COVID-19, our response has really been just really uplifting the voices, right? The stories, the testimonies of women and families throughout the state. And thank you to the leadership of our executive director, Suget Lopez, who really stressed the importance early on in March, when we didn't really know how serious the pandemic was, to all of us as a team, make sure that we were well informed and in touch with our local health departments. And it happened to be that we were in a staff meeting in Ventura, and the meeting almost became about the topic of COVID-19, and none of us were expecting this. So we did take part in the county town hall for the county Department of Health. And so I really appreciated her leadership in that sense of making sure we were all in tune with what was happening. And I'm trying to change the slide here, but I don't know why I don't. Okay. And so some of the issues that Líderes Campesinas already has focused on throughout the years, Líderes has been around for 30 years. It started in the Coachella Valley. Some of the issues that we focus on is environmental factors, labor conditions, violence against women and children, civic engagement, and much more. And so we were very, very busy with over 20 programs. So already, nonprofits like ours already are taking a huge toll and just doing outreach to the communities, to the rural communities. And this is pre-COVID, of course. So we were working hard with the census, right? Making sure people are counted and seeing the importance of being counted. Also very focused on pesticide and exposure and the different dangers in the workplace, and just doing sort of outreach focused on all of these different issues. So that's sort of what Líderes Campesinas has been doing over the years. There's some images of the work. Always doing outreach in the fields. We have here, giving out calendars regarding poison control, how to protect the families and the children, how to protect oneself when working out in the fields. So we're very focused on prevention. Doing a lot of civic engagement with local county supervisors, city officials. And of course, just one of the main things is uplifting the voices of women. And during this pandemic, we have seen that this has been very important. Getting a lot of calls from media. It's been neat to see the media really kind of show this interest and seeing a rise in consciousness of wanting to learn what farm workers are going through. And so we've really been able to help in that sense. For the of you who saw the documentary of Frontline, Cynthia is a member of Líderes Campesinas. So it's not very easy to just go out, due to the longstanding issues that exist. It's not very easy to just go out and get someone to share their intimate, very, vulnerable stories. And that's one thing that Líderes has been very effective with, and we really appreciate those members that are working hard out in the fields and yet responding to requests to be in stories such as that and divulging their personal life. That's the only way really that we are going to accomplish the systems change that we're looking for here. So some of the changes that have occurred has been the cancellation of clorpirifos. I say it better in Spanish, but we have taken part in work groups. It was very neat to see the roundtables that occurred and seeing these different entities like ag representatives, advocates, all at the same table. That was fairly new, and now we're seeing it more during COVID-19. But definitely seeing that it's important to protect all of our families, all of our communities from environmental factors such as pesticide exposure, contaminated water. So these are all general issues that we have already been very busy, on the front lines. Then came COVID-19. So we've been very, 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 very busy. So we came up with, obviously after being deemed essential by the Department of Homeland Security, we wrote a letter to the governor, just, kind of expressing all of the concerns. We were very overwhelmed getting phone calls, getting different testimonies from people. So we decided to write these down and decided let's record them. And so accompanied with our letter to the governor, we did share also recorded testimonies. We know that with the cough study, we've been able to gather some concrete data, right? Numbers. However, like many have mentioned here, these are things that we already have known exist. Nobody knew we were going to face a pandemic, but one of our major points that we're making, and we sort of, started by really using the hashtag always essential, is that farm workers need to be treated as such. They've always been essential. Our economy of California, 50 billion in revenue, thank you to the farm workers. So the welfare of our state is thanks to the agricultural workers that are not being granted the same essential human rights. So that's some of the things that we expressed. And being an organization made up of women, we decided we would also dedicate our letter to the first partner, Jennifer Newsom. And so some of our concerns that we continue to focus on today is inadequate health education in the fields, and also inaccessibility to healthcare. We were seeing that early on. It was the mayordomos, which are the supervisors, being given, giving these orientations out. And nobody, not even us as, community organizers that were learning what COVID-19 was, we weren't even equipped to do this kind of education. So we identified very early that we need the right people kind of going out to the field, especially with a vulnerable population that never has that one-on-one interaction with healthcare professionals. And these are people who, as we know, have pre-existing undiagnosed conditions already. And so building that trust with healthcare professionals has been our #1 goal. And so we were very grateful to be able to collaborate with specific volunteer doctors in our different areas where our chapters exist. And so these were some of the concerns. Some, of course, you know, have sort of calmed down a bit, like the lack of food. We know like organizations like UFW, which we've really been able to help and volunteer there and getting the food out in small towns like Greenfield and different other areas in Lamont, I believe, Kern County and Ventura. So a lot of this has really helped when we wrote a letter and many others wrote letters, was getting on that same page and seeing who was going to be helping in what areas, right? Because we all can't do everything. And so here's just a YouTube, but that's in our YouTube channel. It's the Voices of the Farm Workers. Very powerful, powerful statements. And we have many more. So here's some of the images of the PPE distribution that, you know, we like has been recognized. Many, the state did not have access to PPE, to masks, facial coverings. So we got a lot of donations. We ended up distributing over 140,000 masks. And so this is some of the work we have here: Sonoma County, Ventura, Fresno, different areas where PPE has been distributed. And this was a collective work, really, because also we have our own stay-at-home regulations. So a lot of times it was the farm workers themselves working with us, right? And they are farm worker leaders as well. So they would go out and give this PPE. So it's very neat. Like when we say about engagement, it's really about them also going and taking all of this to the field and recognizing that they are making this effort, and for employers to embrace that and to recognize it and to reward them if that's possible. Here's some of the work we've also been doing is Take It to the Field is another initiative, really promoting for healthcare professionals to go to the field. We have here Clínica Sierra Vista in Kern County that goes out. Líderes Campesinas has helped to coordinate the visits because a lot of times that's difficult. The first team that we worked with here down below on the left is the backpack medicine team in Ventura. So we really praise these, you know, essential frontline workers, healthcare professionals that knew the importance of going out to the field and educate one personal interaction with a doctor so that people would know we also didn't want to overwhelm the testing when there was rarely, you know, there wasn't too much testing available. So it was also letting them know when to go test, right? And that they're not going to go into debt. Here in the middle, we have the example of the Monterey version done by Natividad Hospital. It's called the Charla program. So there's different versions, right? What we really would love is for there to be an executive action to say, if you're an agricultural employer, please accept, if you are approached or you have this available in your area, to make use of this. Because what's happening is people are, agricultural employers are not, haven't been very easy to accept these things. I think now that things have sort of progressed and gotten worse, they see the use in it, but it would be nice to just have an amplified message that if you have doctors in your area, like over here, top right is Coachella Valley, bottom right is Santa Maria. And so these are doctors ready and available to go to field. And this should be something that now it is required to implement a prevention program. And Kalosha, we know that Kalosha has been stressing that lately. So this helps, this counts, I mean, for employers if they do invite the doctors. So these are some of the programs and what we do. Really appreciate Ventura County now we consider this a systems change, right? Cultivating health in agriculture. Now it's become an actual program by Ventura County. And that to me is thank you to the backpack medicine team who just took that initiative and went out there. And we have ourselves also, Líderes Campesinas, we just did a MOU with the County Department of Health in Ventura. And that's to go out to the housing complexes of South Oxnard and do outreach regarding COVID-19. some of the other work, you know, just us as a small organization that is statewide, but we still are small in considering our capacity. We've been breaking these barriers when it cultural employers. So something that we really have appreciated is the ag commissioners who have taken the initiative to create an agricultural advisory and to work with community groups such as Líderes Campesinas, MICOP, CAUSE, and others, and ALRB has been, and CRLA, are involved in these conversations. They're sitting here at the table creating a COVID-19 agricultural advisory. So some are a little bit more intentional than others when it comes to this collaboration, and that would be one of the critiques I may have, you know, if we compare the advisory of Ventura to county, there really needs to be that intentionality of working with advocate groups. And the Kern County just also made their ag advisory. And so at the bottom of these ag advisories, you will see resources. And I love how he put UFW, Dolores Huerta Foundation. So you'll see the differences, right? So I think the goal here is to create these ag advisories throughout the state. Sonoma County is also working on one. And so, yeah, that's some of the work that we're doing. We're also working in these coalitions that were spoken of in Monterey, Ventura, Sonoma. Santa Barbara has an incredible coalition, and these are a mix of healthcare professionals, attorneys, Department of Health, and advocates. And so I think it's very important to create these sort of statewide coalitions and all of us be in sync. And thank you again for all of you for letting me speak today. Thank you.
Thank you so much, Irina, for all the work that you're doing and for also giving this presentation. It's very informative. I know you have to go in a little bit, so I don't know if we'll get a chance to ask you some additional questions, but just thank you for all of your work. Really appreciate it. Next, can we hear from Arsenio Lopez from MICOP?
Hi, I would like to share my screen if it's possible.
Okay, I think you can do that now.
Thank you. Y tal vez fue una mala interpretación de mi parte, pero creo que me invitaron a hacer mi presentación en español, se lo voy a hacer en español. Si está bien con ustedes. Muy buenas tardes, soy Arsenio López, soy director ejecutivo con la organización comunitaria Proyecto Mixteco Indígena. Es una organización que está apoyando, organizando y empoderando a la comunidad migrante indígena en la costa central de California. Muy recientemente nos hemos movido con el trabajo en el condado de Santa Bárbara. Gracias por invitarme a compartir un poco del trabajo que nosotros estamos haciendo, principalmente ahorita durante el COVID o el crisis del COVID-19. También les comparto que tenemos una radio comunitaria, se llama Radio Indígena, 94.1 FM, por si están localmente en el condado de Ventura. Solamente se escucha en esta área. Quiero compartir un poquito cómo ha sido el impacto del COVID-19 hacia nuestra organización, pero antes me gustaría compartir un poquito de estadísticas de lo que es la población indígena en el condado de Santa Bárbara y Ventura. En esos dos condados se estima que la población indígena es aproximadamente de 50,000, muchos de los cuales hemos identificado, sabemos que trabajan en la agricultura o la industria de la agricultura. En sí, nosotros estamos estimando que aproximadamente el 60% de la fuerza laboral está representada por campesinos indígenas, muchos de los cuales se les considera a trabajadores esenciales durante lo que es la pandemia del COVID-19, pero como ya lo han mencionado algunos antes en las otras presentaciones, no tienen los beneficios esenciales tales como se les considera.
Permiso, señor López, me permite, señor. Hola, Arsenio, es Santiago. Disculpa que le interrumpa. Le iba a pedir si es tan amable de elegir el idioma español en lo que es en la pantalla de Zoom hacia abajo. Puede elegir español, así los participantes pueden escuchar la intérprete mejor.
¿Dónde
dentro del programa, hacia abajo, donde se puede ver que hay, pueden elegir el chat, participants, hay un globo que te da acceso a los idiomas. Puede que diga translation available o traducción, y si elige el idioma español, la intérprete puede hacer su trabajo un poco más fácil y los demás lo pueden escuchar mejor, o más bien escuchar la interpretación, la traducción.
Creo que ya lo elegí. ¿Está mejor? ¿Quieren que repita desde
Gracias.
un principio?
Disculpe.
¿Quieren que repita desde un principio?
We could hear it, but I think now we'll be able to hear it much better.
Okay, that's
So
great.
I think
Thank
we
you.
can.
Es algo que para mí es importante mencionar también, es la narrativa que estamos escuchando. Yo como veo el COVID-19 es un poquito en la comunidad latino, indígena, campesinos, es un poquito del antes y el después. Antes de lo que fue en la segunda semana de junio y después de lo que es la segunda semana de junio. En la segunda, a partir de la segunda semana de junio, creo que el número de casos positivos ha incrementado demasiado en ambos condados, en el condado de Santa Bárbara y Ventura, pero desafortunadamente mucho de lo que hemos escuchado es que se le culpa en sí a la comunidad latino por nuestras costumbres o nuestras tradiciones de ser fiesteros, por lo cual el número ha incrementado demasiado. Más sin embargo, creo que es importante considerar que estamos de alguna manera, o no de la manera como siempre, tomando de esa perspectiva de la ignorancia, que no estamos viendo que las razones reales es por las condiciones, ¿verdad? La exclusión social y socioeconómicas que nuestras comunidades han vivido durante la pandemia y antes de la pandemia. La población, también sabemos que dentro del condado de Santa Bárbara y en el condado de Ventura, antes de la pandemia ya, ¿verdad? Basado en algunos datos o estadísticas, 77,000 son personas que no tienen un seguro de salud en el condado de Ventura y 84,000 personas no cuentan con un seguro de salud en el condado de Santa Bárbara. En el condado de Ventura, 49,000 de esos 77,000 son personas que no tienen seguro médico por su estatus migratorio. Quiere decir que son indocumentados. Y en el condado de Santa Bárbara, 30,000 de los 84,000 no tienen un seguro seguro médico por su estatus migratorio de indocumentados. ¿Qué pasa con nuestra organización? Pues a partir de la pandemia, nuestro trabajo se ha de alguna manera transicionado desde un trabajo virtualmente. Todos nuestros trabajos estamos tratando de seguir con el trabajo de verdad utilizando estas nuevas herramientas o tecnologías, pero es importante reconocer que hay una limitación, ¿verdad?, dentro de nuestra comunidad en el uso de la tecnología, desde campesinos hasta estudiantes de high schools y universitarios, basado en la comunidad que están viviendo. También en nuestra organización hemos visto que se disminuyó la solicitud de servicios de interpretación. Mensualmente teníamos un aproximado de 300 horas semanales. Cuando la pandemia surge, no eran más de 50 horas al mes. Se nos vino el bombardeo de demandas de producir PSAs, que son los anuncios públicos para radios y producción de videos. También empezamos a ver un alto número de violaciones laborales por falta de reforzamiento y cumplimiento de la ley. Es difícil determinar cuánto será la reapertura. Esto es una situación constante. Las oficinas del gobernador Newsom hace unas semanas atrás dijo, vamos a reabren el estado y llega a verdad lo que es el número de casos positivos en nuestra comunidad latina. ¿Cuáles algunas acciones que hemos tomado como organización? Creo que también, como menciona la compañera de líderes campesinas, estamos siendo parte de mesas de trabajo, tales como la iniciativa de Santa Bárbara, con la directora de salud pública, con organizaciones y otras agencias gubernamentales, para poder hacer un plan de respuesta rápida para el COVID-19. También hemos reunido refuerzo con la organización que hemos trabajado ya por varios años, con la organización Causa, cuando vimos todo esta números tan grandes de positivos en los casos de los trabajadores H2A. Y mandamos una carta para la mesa de supervisores del condado de Santa Bárbara y Ventura. Y la respuesta fue muy buena. Nos dijeron que están haciendo mucho trabajo de educación y alcance, lo cual aplaudimos, pero lo que nosotros estamos en nuestra posición, hace falta el reforzamiento y hace falta el cumplir las leyes. También el trabajo con situaciones de casos con COVID-19, en los casos positivos. Como organización comunitaria, nosotros siempre hemos estado en una posición donde la comunidad es el primer lugar donde llega, ¿verdad? El antes y el después de los casos positivos es cuando la comunidad viene, ¿qué hago, no? ¿A dónde voy? ¿Qué es lo que puedo hacer? ¿Qué beneficios hay para mí? Y nosotros empezamos también a crear o alcanzar a las agencias con las que estamos colaborando para poder entender esas nuevas leyes laborales del COVID-19 y poder ayudar a nuestra comunidad. También hemos iniciado algunos tipos de iniciativas de asistencia financiera para ayudar a nuestra comunidad. Hemos sido parte de colaboración de distribución de alimentos y también diseccionar las nuevas leyes laborales, porque es muy fácil decir, aquí están las 80 horas, eso es lo que va a suceder, pero cuando llega en el momento de que el trabajador, para saber qué significa eso, es donde es difícil de entenderlo, ¿no? Sitios y citas de dónde hacerse los exámenes. Muchas veces hizo falta o sigue haciendo mucha falta. También eso ya creo que se comentó, ¿no? Antes de irse a hacer el examen y esperar un tiempo para recibir los resultados, pero si la persona ya es positiva, en ese tiempo ya la persona está en contacto con otros trabajadores. Usamos los medios que nosotros tenemos, Radio Indígena. Hemos lanzado campañas de hacer videos en vivo por Facebook, campañas de textos y audios usando nuestra comunidad. Usa mucho lo que es el WhatsApp y algunos también usan mucho el Messenger. Eso es para que lo tengan presente cuando quieran llegar a la comunidad, en este caso campesina indígena. PSAs en videos, sitios. No sé si tenga tiempo, pero puse nuestro sitio de internet aquí para que ustedes puedan de alguna manera acceder, donde están todos los recursos que hemos desarrollado para lo que es temas del COVID-19 en lenguas indígenas. Son todos esos videos que hemos desarrollado que están relacionados al COVID-19. También estamos trabajando con lo que es el programa del EDD para el alcance al campesino, donde también hemos tenido una página y hemos puesto todos los videos de los diferentes programas que son temas relacionados a derechos laborales de campesinos o temas de beneficios disponibles o recursos disponibles para el campesino en la agricultura. Por último, también hemos desarrollado nuestro programa de SoundCloud, donde las personas estamos promoviendo y escuchar todos los diferentes programas que tenemos para nuestra comunidad.
Todo campesino tiene derecho a una...
Yo solamente lo comparto para ustedes y disculpen, estoy hablando muy rápido porque sé que tengo tiempo limitado. Este PowerPoint lo podemos poner disponibles para ustedes también para que puedan tener acceso a todos los recursos que están en lenguas indígenas. También parte del esfuerzo con el departamento del EDD en este alcance de educación para los campesinos. Estamos tratando, ¿verdad?, de crear relaciones con otras radios comunitarias o radios que están de alguna manera en español llegando a nuestra comunidad campesina, y esas son algunas de las estaciones que estamos teniendo a colaboración ahorita. Asistencia a inmigrantes, fuimos partes de esta iniciativa del gobernador de los 75 millones para comunidad indocumentada, donde la organización fue responsable de distribuir o ayudar, ¿no?, en esto de lo que es el condado de Santa Bárbara y Ventura. Ayudamos a 5,500 personas en 6 semanas para recibir su cheque de 500 o su tarjeta de $500 en asistencia. Pudimos distribuir 2.7 millones en 6 semanas solamente. Aparte de eso, somos parte del 805 Undocu Fund, donde la meta es de recaudar $8 millones porque tenemos una lista de 7,000 individuos en espera de ayuda. Por supuesto, ya hemos estado haciendo. Ahora, ¿qué es lo que está pasando? ¿Qué es lo que necesitamos ahorita ¿qué es la necesidad? yo lo que veo como organización en la comunidad, lo que veo siempre es que estamos, yo veo desde lo que es el campesino o nuestra comunidad hasta abajo y hasta donde están los recursos desarrollándose. Y después lanzamos toda esta campaña de esto es lo que hay, estos son los recursos, estas son las nuevas leyes, pero está por todos lados, no está como centralizado donde el campesino o en nuestro caso nuestra comunidad indígena en general pueda simplemente tener un número o un lugar donde pueda tener toda esta información, porque sigue este problema de que si es un problema laboral en el campo, pero si es sobre la falta de agua suficiente para lavarse las manos, por ejemplo, ¿quién es el responsable de reforzar eso, no? O si son las 80 horas y la persona salió positiva, ¿qué agencia se responsabiliza en eso? Entonces yo creo que es muy importante centralizar eso y necesitamos esos esfuerzos porque hay una gran distancia entre nosotros como agencias y comunidad, principalmente las agencias gubernamentales. COVID-19 y leyes laborales, el antes y el después, porque hay leyes laborales el antes y hay leyes laborales el después, ¿verdad? Y para mí siempre, cuando están hablando de campesinos, hay que tener mucho en consideración una realidad. La comunidad campesina, hay un gran número de personas indocumentadas y cuando somos indocumentados hay miedo y cuando hay miedo hay mucha vulnerabilidad para tomar las represalias con la comunidad. Y podemos tener muchos tipos de leyes, pero si no tenemos sistemas de reforzamiento para el cumplimiento, es muy difícil. Si nos apoyan a poder llegar a nuestra meta de 8 millones, sería magnífico. Y como organización comunitaria que somos en estos dos condados, sigue este cuestionamiento constante y trabajo, ¿no? De cómo seguimos con nuestro trabajo en el organizar a nuestra comunidad campesina. Cómo decirles no tengan miedo y cómo decirles ponte en el Zoom, vamos a dar un entrenamiento de liderazgo y todas esas cosas. Son cosas que uno tiene que estar explorando todavía y definitivamente nos preocupa la estabilidad de la organización para poder continuar con nuestro trabajo en adelante. De nuevo, yo creo que hablé muy deprisa, solamente es un tiempo limitado, pero agradezco mucho la invitación y estamos para preguntas.
Thank you so much, Arsenio. Really appreciate your comments and the information that you're sharing and also all the work that your organization is doing to help provide services to farm workers as well as inform local and state governments about ways to improve those services. I do have some questions and I'm sure some of my colleagues do too. We are going to go on, if you're able to stay on a little bit, we are going to go on to our next panelist, Auralia, and then we'll open it up for public comment and questions as well. So thank you. Auralia, are you ready?
Sí, buenas tardes. Mi nombre es Auralia Maceda, trabajo para el Centro Binacional para el Desarrollo Indígena Oaxaqueño. Somos una organización que tiene alrededor más o menos 27 años de existencia. Nuestra oficina principal está en la ciudad de Fresno. Estamos trabajando en estos momentos en el condado de Kern, Tulare, Fresno, Madera, Merced, San Joaquín y en el sur del condado de Monterrey, que es en las ciudades de Greenfield y King City. Nuestro trabajo está enfocado en las comunidades, en nuestras comunidades indígenas, principalmente los compañeros y quienes trabajamos aquí en el Centro Binacional somos miembros de la comunidad indígena y varios de nuestros compañeros hablan los idiomas mixteco, zapoteco, triqui y tlapaneco. Son los idiomas con los que contamos aquí en la oficina con personal de tiempo completo. Lo que ha pasado en nuestra organización ahorita en lo de la época del COVID-19 es de que ha aumentado más nuestro trabajo. Ha aumentado más nuestro trabajo porque la gente de nuestras comunidades está preguntando dónde están los recursos disponibles que hay. Lo que nosotros hicimos primeramente como organización cuando se cuando empezó la pandemia a finales del mes de marzo, hicimos un análisis de necesidad en nuestra comunidad para saber cuál era la forma de trabajo que íbamos a implementar nosotros como Centro Binacional. Y lo que hicimos fue hacer llamadas a las personas de nuestra comunidad con las que tenemos contacto para asegurar que ellos tienen el equipo de tecnología como teléfonos inteligentes o equipo para poder recibir información o de qué manera íbamos a darles esta información. Nos dimos cuenta de que muchos en sus casas no cuentan con servicio de internet. Entonces era un problema el servicio de internet y también de que no tienen el equipo electrónico. Mucha gente de nuestra comunidad tiene el teléfono básico y el teléfono básico es el que no tiene mucha capacidad para tener aplicaciones como las de YouTube, Zoom o otras, o eso, ¿no? Entonces lo que decidimos es implementar nuestro trabajo haciéndolo a través de mensajes de texto o a través de WhatsApp. Y lo que nosotros empezamos a hacer fue crear audios y videos pequeños de menos de 2 minutos para que pudiéramos pasárselos a nuestra comunidad. Otra de las formas también que nosotros hemos estado trabajando con nuestras comunidades es de que muchos de nuestros pueblos están organizados por comités de pueblos. Entonces ellos son también una parte muy importante con la que nosotros estamos colaborando. Ellos como comité de pueblo tienen acceso y información de las personas que pertenecen a su comunidad. Entonces son ellos a quienes contactamos para darles la información, pasarles el audio o el pequeño video y que ellos lo transmitan al resto de su comunidad. Después nos hemos dado cuenta de que estos videos no han circulado solamente en California, sino que en otros estados del país como Washington, Oregon, Florida, Nebraska, y nos han estado llamando. ¿Por qué? Porque entre nuestra comunidad existe esta red. Lo otro también que empezamos a colaborar con Radio Bilingüe es dando información en idiomas indígenas a través de la hora mixteca que tiene Radio Bilingüe aquí en la ciudad de Fresno. Y hemos continuado dando información. Después de esto, como había dicho, el trabajo ha aumentado, porque si ustedes recuerdan, en el mes de octubre, el presidente, a través de la orden ejecutiva que dio sobre cargo público, mucha gente de nuestras comunidades campesinas, indígenas, se asustaron y empezaron a cortar sus servicios que tenían, como el servicio de medical, o de seguro médico, o también los servicios de estampillas de comida. Cuando todo esto empieza, la gente empezó también a decir, ahora que está esta enfermedad, yo corté el seguro médico que tenía de mis niños, yo no tengo seguro médico. Las oficinas de servicios sociales de los condados estaban cerradas. Entonces habría que ver cómo ayudarles a navegar a las personas de nuestra comunidad sobre estos problemas que estaban enfrentando. Lo otro fue las escuelas, ¿no? O sea, las escuelas empezaron de manera virtual y las personas de nuestra comunidad indígena no podían comunicarse con los maestros de los niños, no podrían, para que les explicaran cómo bajar la aplicación, qué tenían que hacer, dónde ir a recoger las tareas, porque no las estaban dando en la escuela donde le toca ir al niño. Entonces, todo ese trabajo empezó a caer sobre nuestra organización y nosotros teníamos que responder a esto, ¿no? Nuestros programas eran diferentes. Teníamos nuestros programas enfocados en niños de 0 a 5, nuestros programas de migración y todo esto, pero lo de la pandemia cambió todo esto y teníamos que responder a todo lo que está, y estamos respondiendo a lo que está pasando en en nuestras comunidades. Esas son algunas de las cosas. También nosotros empezamos a dar lo del apoyo económico a las familias. Ahorita en todos estos condados, son 7 condados en los que hemos estado trabajando, hemos podido distribuir casi cerca de 2 millones de dólares, y estos recursos vienen de fundaciones a quienes nos han dado estos recursos, y nosotros hemos distribuido a los campesinos, a las personas que no son elegibles para recibir el apoyo, el estímulo económico, y también que no son elegibles para el desempleo, ¿no? Entonces, y nuestro enfoque es la comunidad indígena, porque hay otras agencias, otras organizaciones que han estado distribuyendo fondos a las comunidades, pero tienen su sistema como que tienen que hacer una aplicación a través del internet, o tienen que hacer llamadas por teléfono y enviar sus comprobantes, y eso vía texto. Es tan simple para nosotros, pero para la gente de nuestra comunidad ha sido complicado, que incluso las organizaciones que estuvieron dando los fondos que fueron otorgados por el gobierno del estado, no sabían cómo enviar este comprobante a las agencias que estaban dando los fondos. Entonces nosotros estuvimos ayudándoles a enviar ese mensaje de texto para enviar sus comprobantes. Entonces eso se parece a algo muy simple, pero dentro de nuestra comunidad, como ustedes ya saben, la falta, el bajo nivel de escolaridad que tenemos es lo que a veces no puede, nos impide poder tener acceso a todos estas plataformas digitales y usar la tecnología, ¿no? Entonces, ¿qué estamos haciendo ahorita también nosotros? Nosotros como organización estamos colaborando con otras agencias, con otras organizaciones, para asegurar que los mensajes lleguen a nuestra comunidad indígena y lleguen de una manera culturalmente apropiada, que sea entendible, que sea en el idioma, y que nuestra comunidad esté informada. Hemos estado colaborando con los departamentos de salud, por ejemplo, aquí en el condado de Fresno, para que sepan también cuáles son las necesidades de nuestras comunidades y de qué manera trabajar. Estamos trabajando ahorita con los alcaldes de la ciudad y con la mesa de supervisores para asegurar que los recursos que han llegado a nuestros condados sean distribuidos equitativamente, y que estos recursos sean distribuidos equitativamente y que también se consideren. Ahorita estamos hablando en cuestión de idiomas indígenas, pero también hay otras poblaciones que también están en desventaja y que no están recibiendo los servicios, como son las personas que hablan otros idiomas asiáticos, como el Hmong y otros idiomas, ¿no? También estamos colaborando con ellos, estamos creando esta red de cómo vamos a hacer frente a esta pandemia, para asegurar que nuestras comunidades reciban la información que se necesita, ¿no? Entonces, hay mucho que tenemos que hacer, y siempre la limitante es la falta de recursos. La falta de recursos económicos, y también cómo aseguramos que esos recursos económicos que el gobierno está otorgando, el gobierno estatal, el gobierno federal, se implementen de una manera correcta para lo que debería de ser, ¿no? O sea, para contrarrestar esta pandemia. Lo otro que también nosotros estamos haciendo como Centro Binacional es ir a los campos, llevar información sobre qué es el virus, cómo protegerse. Hemos estado distribuyendo también cubrebocas, hablar cuál es el uso, cómo usar correctamente el cubrebocas y por qué es importante usar el cubrebocas para protegernos a nosotros, proteger a nuestras familias y proteger a la comunidad. Son cosas que estamos haciendo durante este recorrido que estamos haciendo en los campos. Hemos escuchado de los trabajadores que los cubrebocas que han estado recibiendo, que son desechables, no funcionan para los trabajadores del campo. Sabemos que el Estado ha otorgado miles de cubrebocas, pero que estos no están funcionando. ¿Por qué? Porque, por ejemplo, los trabajadores que están piscando el durazno, pasan las ramas del durazno por la cara de los trabajadores, se rompen los cubrebocas. Entonces, al final del día, esos cubrebocas no están funcionando, los que son desechables. Lo más recomendable es usar el cubreboca de tela. Entonces, nosotros hemos estado dando cubrebocas de tela, pero han sido donaciones que la misma comunidad ha estado haciendo para los trabajadores del campo. Esto es lo que hemos estado haciendo, lo que hemos visto en nuestra comunidad, y sabemos que tenemos todavía mucho trabajo que hacer. Y ahorita en este momento lo que vemos nosotros es cómo unimos todos esos esfuerzos para poder contrarrestar la pandemia, ¿no? O sea, sabemos que cada una de las organizaciones o agencias tenemos recursos limitados, pero cómo esos recursos los podemos juntar todos juntos y ver y buscar esta estrategia de poder dar la información correcta a los trabajadores del campo, a las personas de la comunidad, pero también entender de que este problema no se va a resolver solamente dando cubrebocas, dando información, sino que también es un problema más de fondo. ¿Cómo trabajamos para que estas políticas se críen y que haya mejores viviendas para los campesinos, que los campesinos tengan derecho al seguro médico como todo ser humano, que los campesinos tengan el derecho a los días de enfermedad, que se les respeten sobre todo, ¿no?, estas leyes que sean respetadas. Entonces, este es un asunto que nos trae ahorita a la vista a los trabajadores esenciales, que siempre han sido trabajadores esenciales, pero ahorita se les está reconociendo como trabajadores esenciales, ¿no? Pero también saber que necesitamos una política más de fondo que realmente atienda a estas necesidades. Porque ahorita estamos diciendo, quédense en casa y guardemos cuarentena. Los trabajadores del campo no tienen el privilegio de quedarse en casa. Los trabajadores del campo viven día a día, tienen recursos muy limitados que no serían suficientes para perder días de trabajo. Entonces, tenemos que ver cómo esos salarios de los trabajadores ayudan a que ellos realmente puedan tener una vida como se debe. Entonces, es trabajar más allá de que los trabajadores del campo tengan estos derechos, ¿no? Entonces, eso es con lo que me quedaría al final, de que tenemos que trabajar juntos para asegurar que las políticas que tenemos nosotros en nuestros diferentes niveles de gobierno realmente cubran las necesidades que tienen los trabajadores agrícolas, que también son seres humanos.
Thank you so much, Aurelia, for all of that. That was a lot of information. I have a couple of questions, and I'm sure some of my colleagues do too. I also want to thank our interpreter who has been working this whole time, and just thank you so much, Catherine, for all your hard work. I do have a couple of questions actually for all the panelists on this panel, and actually this may be relevant for some of our labor panelists too. One of the questions that I had open to any of our panelists here is about contact tracing. I know that's been an issue just in terms of having enough local resources to actually reach out to people. But then the bigger part, I think, for my question is building the trust with farm worker populations in order to respond. Have you seen any successful messages in terms of making farm workers feel safe sharing this information? Are there any pieces of information that you tell farm workers, like a contact tracer will never ask you for your status or never ask you for your social security number, anything like that you can share? And that's open for anybody.
I think we do recognize that it's always a challenge with trust with farm workers. I think I want to touch a little bit on this, what we're seeing. So when I think there's a lot of, how do you say, stigma right now. That's a feature of this COVID-19 when you are positive, because it's still unknown. And so it's fears to how you're going to be seen by your friends, your family, or, you know, your workers, or other co-workers. So what we are seeing is that farm workers, they don't want to come forward when they are being positive. They're coming to our organization by very in a confidential way, and we need to respect that. And that makes even harder, you know, for, I think what we are seeing is those farm workers that they somehow they already that trust with our organization and they give positive, they come and they say it, but we know there is a lot more there where our people are not coming forward because of the unknown on COVID-19 positive. In Santa Maria, what we're been hearing in the dialogues is that when a farm worker is positive and they're being taking time off from work, but they are not having a severe symptoms, they start looking for another job in a different you know, field or with a different company. Because what we are assuming is that is because there is not really a real, I don't know if it's conversation or awareness or what really it means on the COVID-19 being a virus. And it's not that you are not having a severe symptoms. It doesn't mean that by passing this to other coworkers that might have a pre-existing health condition, that it will be the same with that worker. That other worker might be putting their lives in risk. So, and what I saw like 3 weeks when I was in Santa Maria is that the worker just go in any clinic or hospital, they give the result positive and say you're positive. And I think there is a lack of interpretation. Always is a challenge with language, and both sides, on the work side as well as in the by the health providers. And it makes pretty hard to you know, track these positive cases. I will just stop there.
Just a quick follow-up, based on based on your experiences, are you finding that even the workers that are maybe do not have severe symptoms, are they trying to get paid sick leave? Are they even asking for that?
As Oralia stated, I think this thing about public charge is a big deal in our communities. Our people, many are asking for support, even if it's financial support, but we know that a lot of people are coming forward saying, I don't want to ask this because I don't want this to be a problem in the future. I think what you hear in the media in general is that like public charge, and now this is a new thing. It's not gonna affect your stuff, but I think it's just too late. I think our people already perceive the message, and now they're afraid. So when it comes to the 80 days, 6 days, there's many factors there. People are afraid maybe because they're getting represalias, you know, to be fired by the companies. We've been seeing this, that the companies will say, if you're positive, okay, just take your time off. We're gonna pay you. And when they're trying to come back, there's no more work for them. People, they don't want to put themselves in that position. Or people, they don't want to ask the 80 hours because of they've seen as it can be potentially public charge. So that's a big problem that we see there. But I will let other comment.
I think also in many places, even, you know, Santa Maria, Yolo County, there's been that fear of coworkers knowing, or workers that turn out positive, fear telling their coworkers because they know that the work may be ended. Some employers are stopping the work just to be, you know, safe, or also maybe to avoid paying the sick time. So it's safer to just stop them all for 2 weeks. And so other workers, you know, they don't want that to be blamed on them, that others can't obviously have a job, right? And survive on, yeah. So I've heard that a lot. But in terms of the contact tracing, I did want to say that we really do advocate for community-based contact tracing. And just some of those barriers is obviously the requirements, right? Citizenship being one of them in order to work directly with the health department. But hopefully some of these barriers can sort of be worked through by contracting out with the organizations themselves. But of course, that's another barrier is we need a pathway to citizenship, because especially during a crisis, we know that the ones that are going to really help stop this spread are people within the communities. And so that's why we really advocate for community-based contact tracing. So that's a really good question.
I just want to make sure that I'm understanding what you're saying, Irene, too, is that
Ahorita yo
the
lo que quiero decir es de que, por ejemplo, en el condado de Fresno hemos estado abogando y hablando con los del Departamento de Salud sobre lo de rastreo de contacto y cómo colaboramos como agencia, como organización no lucrativa y que ya de manera que podamos nosotros también ayudar a hacer lo del rastreo. Ahorita tenemos una propuesta de que más como 70 promotores o 70 trabajadores de la comunidad, de las diferentes organizaciones que estamos en el condado de Fresno, podamos colaborar con el Departamento de Salud y hacer este rastreo en el condado de Fresno, porque va a ser más fácil que alguien de la comunidad pueda hacer este rastreo a que si es una institución de gobierno. La gente de nuestra comunidad siempre tiene temor de dar información y de trabajar con instituciones de gobierno. Entonces, esto vemos como una salida de poder hacer el rastreo de contacto. En el condado de Madera, por ejemplo, los encargados de notificar si la persona tiene que guardar cuarentena es el departamento del sheriff. Y eso es algo que nuestra comunidad no tiene confianza, que nuestra comunidad no ha tenido miedo. Entonces, hemos estado hablando cuáles serían las mejores formas y prácticas de que podamos colaborar como organizaciones no lucrativas, para poder realmente trabajar con nuestras comunidades, ¿no? Entonces, esa es nuestra propuesta que tenemos nosotros ahorita en el condado de Fresno. Se está trabajando todavía, porque no es tan fácil que las autoridades como del condado y de la ciudad quieran financiar y quieran soltar ese dinero que recibieron del gobierno federal para lo del rastreo de contacto. Sabemos que han recibido millones y que se tienen que gastar antes del 31 de diciembre. Pero no sabemos qué están haciendo con ese dinero, ¿no? Entonces, es seguir trabajando, insistiendo en las ciudades y en el condado para dejarles saber que si realmente queremos contrarrestar la pandemia, tenemos que colaborar. Y la única forma que la gente va a tener confianza va a ser que otra persona de la misma comunidad a ellos pueda hacer este rastreo de contacto.
Thank you so much. That is really, really helpful, and I hadn't heard that discussion around contact tracing. Do you know of any counties or localities, either here in California or even other states, that have been able to utilize community-based contact tracers?
Hasta ahorita no hemos sabido y por eso estamos empujando duramente esta propuesta en el condado de Fresno y se la hemos presentado a la oficina del gobernador también para que la revisen y que sea un modelo que se pueda hacer, implementar en todo el estado de California, de que sean las organizaciones de la comunidad a través de trabajadores comunitarios quienes hagan este rastreo de contacto, porque es así como se va a dar esta confianza en las personas que han sido positivas y de poder rastrear esto, ¿no? Entonces, no sabemos en qué condado se esté realizando, pero al parecer no, pero esta es una propuesta que 17 organizaciones del condado de Fresno venimos juntos y lo presentamos, ¿no? Entonces estamos esperando y como digo también ya se presentó a la oficina del gobernador para que la analicen y vean de que es una propuesta que podría implementarse en todo el estado de California.
Very appreciative. And Irene, one question I had for you was, so are you hearing that in order to be a contact tracer, one must be a citizen? Am I correct in understanding that's what you were saying?
Yes, that's one of the requirements, because they did, they opened up the job to furloughed county employees. And so in these coalitions that I'm a part in, that's kind of the first question I would ask when the idea of community-based contact tracing came to us a few months ago, right? And so it was all a learning process, but that's what the first question was, what is the job description? And so it was county furloughed employees, definitely, specific, I don't know what the specific degrees are, but it is, I believe, college perhaps, and then speaking English, and at that time, I think they were actually furloughed employees. I was looking here just because of the question you asked. There has been a good kind of model that was used in the Mission District in San Francisco with community-based contact tracing. It's not, farm workers, but also in Florida, I've read of some, not just with contact tracing, but really getting people out to do the testing. And these were community-based organizations, but they were also working towards community-based contact tracing. But yes, citizenship is definitely a requirement in order to do the one that's through directly with the public health department. But I think, like Oralia says, some things are being worked out. There's also a big project hopefully coming about with UC Davis, with partnered with doctors, researchers, and community-based organizations. And it's to get rapid testing to farm workers in rural areas, as well as community-based contact tracing. I know Sonoma County also has a great RFP, and that's a holistic approach to wraparound services in response to COVID-19. And we also shared an action plan for community-based contact tracing that hopefully this RFP will lay the groundwork for that. So it's in process. It's just not happening yet everywhere from what I know of. Thank you though for the question.
Very informative. Thank you all for your feedback. I have other questions, but I want to open up the floor to my colleagues. Do any of my fellow board members have any comments or questions for either this panel or the employer panel?
I have a question on the public charge issue. So I understand the idea or the public charge being a barrier for folks to access the 80 hours paid leave. I was just wondering, are there any efforts to work with maybe community-based legal organizations, or what kinds of efforts are being made to educate folks that, in fact, the 80-hour paid leave will not count against them for public charge purposes?
In our case as organization, we are an organization who we have 20 different programs. So one of our programs is immigration legal services that we do provide, as well as outreach and education about immigrants' rights. So when it comes to like individuals who reach out to us asking for those specific questions, it's for us, we just do a referral to our staff and say, can you take this case and meet or call the person and just explain where we are with this public charge. And the second thing that we do is that we develop PSAs or Facebook Live where we provide this information. I think again it's just the community is pretty big, it's large. There's some people that they are getting information from through other kind of medias, and there's a lot to ponerlos in these like little breakdowns all what does that mean, public charge, because it's pretty easy especially for the Spanish medias when it comes to like public charge and just talking about this super high language register. It's pretty hard for our communities to absorb that and say like, what does this mean? It means that, you know, now I'm gonna be, you know, in the future is gonna impact me or not. So they need that extra help. And that's when I strongly support what Oralia, you know, keeps saying. When it comes to our communities, we need to be able to create kind of like programs that it's community by community, so people by communities, train our people from our communities and use these models that exist there. You know, it's models of promotoras, models of community outreach workers, people who speak the language and train those communities to pass out those informations there. And I think that's still a big problem. Like language access in general is a big, huge problem still. There's a lot of that is being done to train at the work sites, you know, to provide trainings. But if trainings are not being in the language of the farm workers speak, it's worthless. You know, you can keep doing these trainings, but if you, that's one thing, and you can keep training the supervisors and having bring this up, but there's still a lot of issues about discrimination and racism within our own farm worker communities. So often if you have a supervisor or a crew leader who is from a Spanish only speaker person, and you have like the rest of the workers are, you know, Mixtecos, Zapotecos, Triqui speakers, you know, discrimination and racism can play a crucial role there. So you're training a person that might be having hard or difficult time to provide this information to the indigenous speaker workers. So there's a lot of factors, but I think if I can contribute something a little bit more, it's just that trust is being built through the language that you speak and with people that speak the same language. And that's being lacking in our system.
Thank you. And then I had another question for Oralia specifically. You mentioned, you know, some of the farm worker populations that you and your organization work with directly don't have access or just rely on a basic kind of phone feature. I know in this COVID time that we're living, a lot of us have relied on remote platforms, whether it be apps or whether it be Facebook or a website. You specifically mentioned WhatsApp, and I just maybe anecdotally, if you could let us know how effective you think WhatsApp is at communicating to folks, and by just your participation in the survey, whereby I believe it was like almost like a third of the respondents came from your organization. It seems that it is fairly effective. So I just wanted to see what your thoughts were on that.
Primero, lo que mencioné es de que las personas con las que nosotros hablamos para ver cuando hicimos este análisis de necesidad, era de que sus teléfonos son muy limitados y porque la mayoría de las personas o muchas de las personas tienen teléfonos de los que otorga el Estado. Entonces, no sé, al menos aquí en el Valle, en varias esquinas hay puestecitos en donde están dando estos teléfonos a personas de bajos ingresos. Y es lo básico, es para hacer llamadas al doctor. Y creo que este programa es del programa que se llama Lifeline, algo así, que es un programa del Estado igual, que otorga servicio telefónico a las familias de bajos ingresos por una cantidad de $10 al mes. Entonces, muchas personas ahora están optando, en vez de tener teléfono en casa, tienen los teléfonos celulares, pero son estos, por eso es que tienen una capacidad muy limitada. Y nos dimos cuenta porque las familias, para poder accesar a las plataformas que usan el distrito escolar para que los niños tengan acceso a a las clases que se están impartiendo en las escuelas, los papás tenían que tener un correo electrónico. Y era es tan básico que ni siquiera un correo electrónico podíamos bajar a través de ese teléfono. Entonces, esa es nuestra experiencia de nosotros trabajando con las familias, y no con esto voy a generalizar de que todo es así, pero sí pero las personas que realmente necesitan el mensaje en su idioma, esta es la situación en la que se encuentran. Lo otro, en cuanto a las encuestas que menciona, esas encuestas, nosotros como Centro Binacional fuimos parte de este estudio con California Institute for Rural Studies, y nosotros levantamos 327 encuestas en diferentes partes del estado, en Santa María, en Greenfield, King City, Watsonville, Salinas, Gilroy, Hollister, Stockton, en Merced, Livingston, fueron en todos estos condados, y luego en el condado de Kern, que fue en Irving, Lamont, Taft, Shafter, y aquí en Madera y Fresno, Tulare también. Entonces fueron todos estos lugares en donde nosotros estuvimos levantando estas encuestas con los trabajadores en idiomas indígenas. Entonces, y lo hicimos vía telefónica. Entonces no tuvimos un problema, digamos, en cuanto a la comunicación con él, porque fue vía telefónica la entrevista que se realizó.
Thank you. Do any of the other board members have comments or questions?
I have a question.
Go ahead, Barry.
I don't know if any of the employer representatives are still here, but if they're not, because this would be best answered by them, but somebody else could comment too. My question is, a mask, not all masks are created equal, and obviously N95 masks are the most effective, and bandanas, I just read this morning, although they kind of look cool, they are completely ineffective. And so the question I have is, what kind of masks are employers getting, and how do they make these decisions? And is there any circumstance in which they're supplying workers with N95 masks, especially if they work in conditions like field agriculture, where sometimes people work much closer than 6 feet from one another, or in packing sheds and other places? So that's my question.
I don't know if we have the employer reps on, but if anyone else wants to answer that, that'd be great.
This is Estella. I can answer based on what we've seen. We've seen the disposable masks that some employers have been obtaining from local county ag commissioners. We've also seen cloth masks. In terms of N95 masks or respirators, we haven't seen a lot of those yet. It may be due to supply, unless they already were being provided by the employer based on the occupation, or for example, like pesticide sprayers may already have access to those. So that's what we've seen in terms of the masks that are being provided by employers to employees.
Thank you.
I would just say that's the same that has been our experience. Disposable mask, not that many N95 masks. The other reality is that a lot of the employees are not getting the equipment that they need. I mean, that's another kind of, like, we're coming back to this recommendation it needs more reinforcement there. So maybe this is so out of the box, but one of the things that, like, for example, the clean restrooms and issues and, you know, water, enough water and water to be close to employees so they can wash their hands constantly. That only gets improved when, you know, there is reports from workers, one, and the Kalosha or, you know, an agency actually do a visit to the fields. But what we have seen is that Kalosha will notify the company before getting in the company. So of course, when you get there, you see everything looks perfectly, you know, as it's supposed to be, because there was a previous warning that there was some site inspection. We see an issue with that. It should be like surprise visits. And I know there's some work that needs to be done there. The second thing I think it's that we are working locally is working with public health directors of, there are some level of reinforcement that it can be done at the county level, especially now during the pandemic times. But often what we keep hearing is that there are some state agencies who are responsible, or this is the state who needs to reinforce this. But I think at the county level, it's something that can be done. So that's another work that we as CBOs are constantly, you know, pushing and advocating for.
And if I could just very quickly add to what Arsenio is saying. So we have struggled with having Kalosha go out to do field enforcement related to COVID-19 complaints that we've had that workers have filed with us. So, you know, that's one thing that we're trying to work through. Another thing is as well that we've also filed complaints with local public health departments that are doing some sort of enforcement, have struggled with that. So those are like two sort of opportune, right, enforcement measures, right, that we have struggled to kind of see to fruition, or sort of seen anything kind of actually trickle down to, you know, changing a workforce, or at least a local place. And then the other thing that I was just going to mention is that in some counties, it seems like, for whatever strange reason, the state agencies aren't even working together. So Kalosha isn't working with the public health departments, which seems strange to me. So it kind of just even goes back to like the basics of, you know, different agencies talking to each other on an issue that very naturally, you know, they're aligned. So that's what part of what we've been seeing as well.
Thank you. I do just want to touch on that. And also this came up with Arsenio with your presentation as well. There's certainly more improvement needed in terms of coordination across state and probably local governments as well. One thing I want to highlight is Secretary Julie Sue has really emphasized and put forward an initiative, and that is some of what the budget positions that the General Counsel announced at the beginning of the meeting are going towards to improve coordination, particularly with Kalosha, the Labor Commissioner's Office, and us, the ALRB, directly servicing farm workers, obviously given our jurisdiction. And so we are working on hiring people to do kind of generalized outreach efforts. We understand, you know, the Secretary always says people don't know where we draw our lines, and we know that workers' time is valuable, plus they may be scared to come forward. And so when a worker reaches out to any one of us, we should be able to assist them, even if it's not something within our jurisdiction. We can't enforce that. We can't enforce the Kalosha regulations, but we can give, really help that worker, get them to Kalosha, improve our internal referral system, and make sure that that is followed up on. It's still in the beginning stages. There's still work to be done, but I do want to acknowledge that we definitely are aware that that is a real issue and a problem, and one that we're working on improving. And it's something that is really being supported from the very top. And so again, really grateful that Governor Newsom prioritized that in his budget, because he agreed that was something that we need to keep doing. So hopefully you'll see the fruits of those efforts soon. We are working to fast track that, particularly with COVID-19. Any other comments or questions from my colleagues?
Ralph, here, a real quick couple of items. One is a follow-up on the WhatsApp discussion that we just had. I think that the general counsel's, the information we put out is, we use our web page and we use Facebook. I'm seeing Drew, the general counsel, nod. If we should be using WhatsApp or some other mechanism to reach people that don't have smartphones, I think it'd be good to get recommendations from you all about what we should use. So that would be one comment, and you just send it to us, or you could make it now. And then I had one other comment about reduced hours and wages. I don't know if anyone wants to comment on the WhatsApp issue. If there's no comment, just I would love to have your recommendations on how to reach people that don't have smartphones and have these less robust phones. So, and the second thing is, and unfortunately, I think the employers have left, but I think I heard a consensus there are reduced hours. But I think I also heard during the labor panel that there's been a shift away from piece rate pay. And I'm just interested if anyone has comments on any significant changes in the way farm workers are being paid today.
If I could just very briefly address that, I haven't seen, not to say that it's not happening, but I haven't seen that shift. So I don't know if other community groups that are working with farm workers have seen it. But I was going to very briefly make a comment about the ways that we can reach farm workers. Because I believe earlier somebody asked the question as well about outreach strategies. So we really have had to shift our outreach strategies because we do a lot of outreach and community education as part of our work statewide through our community workers as well as other staff members. And so we used to do a lot of in-person community education and outreach, which consisted of public health fairs, other kind of community events like that, where we would go and table and talk to people one-on-one. We used to do a lot of small group presentations to different community groups or just groups of people that request, can I get a know your rights on XYZ? So we've really had to limit those to small groups, as well as we're trying to figure out whether we can, hold them outdoors, in a socially distance manner to keep everybody safe to the extent that we can. But we also have had to do sort of more kind of new outreach strategies. We've generally tried to do TV and radio, like short little spots on different rights or different topics, or simply, CRLA is here, please, come to our office if you need help with XYZ. Definitely videos and sort of other short segments on Facebook. I would reiterate the use of WhatsApp, especially for some of the H2A work that we do for H2A workers, who don't have, may not have a US-based cell phone service, right? But they have one in Mexico with the use of that app. We've had to switch to doing sort of leaflets and flyers at doctors' offices, outside stores. We've kind of done that throughout the years, but definitely much more of that. Just sort of go where farm workers are. If there's a store that people kind of frequent right after they get out of work, right? We've held what we call like drive-throughs events where people pick something up from us, but it's in a drive-through manner, so nobody has to get out of their car. It's contactless, car caravans, because part of, and I know other organizations or worker organizations that have been part of this discussion have also been doing census work. And so CRLA has also been doing census work with farm workers, and we've really had to switch the outreach strategies there because a lot of it depended on sort of the person-to-person contact that, is no longer safe for people. So I just wanted to kind of throw those out there as kind of different outreach strategies that we've utilized, and also reaches workers that may not have smartphones. But then of course there's also the concern of of our farm worker community that doesn't have the ability to read. Sort of handing out leaflets, right, is not useful to them. So it's also actually involved a lot of a lot of one-on-one calls, which is why we encourage people to call us, because that's another way that we can remain accessible to people that, you know, we miss out on if we just distribute written information, which we distribute plenty of as well.
Solo quiero reforzar lo que acaba de decir Estela, de que esas son formas en las que podemos seguir informando a nuestras comunidades y sobre todo también los medios de comunicación. Es algo muy importante porque es otra forma que es a través de escuchar, ¿verdad? Y en la televisión también a través de ver. Entonces también es importante hacer estas relaciones o crear estas relaciones de colaboración con los medios de comunicación, ya sea la radio, la televisión, y nosotros desde nuestra experiencia han estado disponibles para colaborar con nosotros. A principios del mes de julio, nosotros iniciamos una colaboración con Univisión La Costa, con quienes estamos produciendo información y es más sobre el COVID-19 todos los días y lo están pasando en horarios importantes como es en la hora de las noticias. Nos dan 1 minuto a las 6 de la tarde y 1 minuto a las 11 de la noche. Entonces esa es una de las formas también de cómo podemos asegurar que esta información llegue a nuestras comunidades, llegue en su idioma, porque nosotros ahorita lo estamos haciendo en mixteco. Entonces, eso sería, ¿no? O sea, crear esta colaboración con las estaciones de radio y con las estaciones de televisión. Ahorita estamos también mostrando este ejemplo con Telemundo y con ellos para ver también cómo replicamos esto para mantener informados a la gente de nuestras comunidades y nosotros a la gente de nuestras comunidades indígenas, que son los que tienen la limitante de leer, escribir y estar activos en redes sociales y en plataformas digitales. Entonces, ¿cómo podemos buscar esta otra alternativa también?
Thank you. Any other comments or questions from my fellow board members? Okay. I'd like to open it up again to public comment. First, we'll go, Santiago, is there anyone in the comment queue?
Yes, one of our participants, sorry, I'm unmuting here. One of our participants doesn't have access to the audio tool, so I can restate her question, and it is directed at to CRLA, which I think Estela in part answered, but the question is, what is CRLA using to hold employers accountable and with what results? It's a multi-part question. Some of the examples of types of strategies is causes of action, types of claims, strategies or approaches. And then a second question is, who has been your most meaningful enforcement arm amongst state regulators? Question is in the chat box if you want to reference it, Estela. I think you saw it.
Yes, thank you so much. So a lot of what we've been doing involves working with different agencies, Cal OSHA, local county health departments, county, ag commissioners, sort of filing complaints, following up on them. That's one aspect of things that we've been able to do. Another one has been when we can, kind of stepping in to kind of raise concerns about things that are happening. So one example is out of the El Centro office. we became aware that the local courthouse was actually continuing to process eviction notices despite the moratorium. So we got involved there and kind of let them know about the law and that they should be following it. And so, you know, that's kind of another aspect of things that we've done, as well as working with the labor commissioner. You know, there's different branches that we've worked with throughout the years in terms of information, as well as processing wage claims and all of that. As well as a lot of demand letters, calls to employers. We have, and then also advocacy with like unemployment insurance. So there's that kind of work where we, again, do like sort of what we were doing before, but with a slightly different angle or a slightly different sort of different issues, because a lot of workers are calling us about problems accessing unemployment insurance, as well as problems accessing the paid sick leave. And so some of it involves sort of negotiation or sort of reminders, right, to employers about following the law, as well as any follow-up needed if they don't follow the law, and kind of trying to the extent that we can, provide sort of wraparound referrals for workers that do contact us that are sick or believe that they're sick, referrals to local clinics and sort of other services that we don't provide as a legal office, but you know that we have knowledge about because of the collaborative work and just kind of being out in the community. A lot of public information, so know your rights to the extent that we can still do that, to the extent that we do our outreach. We haven't done any litigation yet that I know of statewide, but you know, as a law firm, that's something that I think other attorneys have kind of done, but a lot of it has involved the community education and sort of providing the necessary legal recourse if possible, if needed, for workers and sort of families that reach out to us. Another thing as well that I should mention is, you know, we've been trying to assist families to the extent that we can, not just with housing, but also with education issues that are kind of coming up related to COVID-19, with students needing to work from, be in school, with the return to school. A lot of each district is doing different things. There's a lot of concerns with special education students, especially, and other children that need, you know, the direct services. So there's a lot of concerns there and a lot of work to be done there. So nothing innovative, but definitely continuing the work that CRLA has been doing for a number of years, and doing the best that we can with providing the community with the legal knowledge and tools that are accessible to them.
Thank you. Are there any other commenters in the queue, Santiago?
No one that has indicated their wish to comment right at this moment. However, earlier during the presentation, two employees, two ALRB staff members had questions that they can restate now. Silas, if you are still on the call or the training, you can restate your question.
That's okay. I think it's basically been addressed through some of the other presentations, but thank you for that opportunity.
Okay, thank you. And then I believe Anna Marie had a question.
I had addressed the classes, I think 3 of them, 3 questions. Is that the one mainly?
We're unable to hear you, Anna Marie. If I believe the clamshell on your laptop is closed. If you open it, I think it'll be easier to hear you.
Okay, can you hear me now? Okay.
A little bit, yeah.
Okay. One of the questions that I addressed is, would it be safe to say that farmers should be mandated by the government to provide to farm workers?
Can folks hear her?
Anna Marie, we're having a little bit of trouble hearing you.
Okay, let me move my laptop.
Okay, that's better, much better, yeah.
So really, my concern, I'm a 3rd generation farm worker, And one of the problems has always been that they have the lack of water, the lack of clean outhouses, and not a place to eat when the sun is beating down on you. So what I wanted to say, would it be safe to say that the farmers should be mandated by the governor to provide to farm workers these essentials that has always been an issue now that COVID is here, because drinking, clean drinking water and clean outhouses and tarps and toilet paper, that has always been a problem. Should the governor be mandate farmers to provide that to the farm workers, because COVID in and of itself brings more new issues to what's happening. And I wish he would mandate, because a lot of these farm workers, I mean, we're going back, like my grandpa was a farm worker. He was 94. My dad was a farm worker, and I had to be out there too. But I had decided not to. I needed to go and study to college, because my dad said, "Mija, being out in the fields is not for a woman," because he saw how it was back then. It was hard. And I heard a lot of true stories that with the braceros and being out with people out in living in government housing, having to go to schooling in the center of a government housing. I see all that in my eyes, because I've lived it, and these are things these are questions that have been it's been happening for years, and nobody has really done anything about it yet to fix it. I wish that they would at least mandate the main things like water, and because honestly, if you don't have clean water, and if the farmer comes and brings a thing of water, you don't know where he got it. Sometimes you can get H. pylori if that water's dirty. Or even in Mendota, when I used to visit my friends and their drinking water from the faucet in their home came out brown. And I said, "Well, your water's brown." They go, "Yeah, that's the irrigating water." I said, "Why are you guys, receiving this?" And they didn't know why. So these are issues that people don't really know about, that I've lived it and I've known it and I've seen it. But these are issues that has been happening for years. And that's what I want to say.
If I can just respond, Ana Maria, the drinking water, wash water, and toilet standards are mandatory and enforceable. They're Cal OSHA standards. So they've now been mandated.
Thank you.
Mm-hmm.
If I could just very briefly respond to that. No, definitely, thank you. They are required, and I think where we kind of run into concerns with COVID-19 is that right now the guidance that is put out by Cal OSHA is guidance. So it has to be part of the employer's IIPP, the Illness and Injury Prevention Plan. I can't comment on what needs to be, I can't comment on laws or whatnot, but guidance is different than actual regulations or a law. So I think that's kind of where you're seeing a lot of issues, because it is very site specific, it is very employer specific, sort of what is going to be sort of required, right? If a worker does call in to make a complaint, the water, the shade, the restrooms, the hand washing stations, those are regulations. Those are very clear. with COVID-19, it's something that a lot of employers, not just ag employers, are kind of facing in terms of what's required, what's recommended, what do we follow? Do we follow what the CDC is recommending? Do we follow what Cal OSHA is recommending? Do we follow what local counties are recommending? So it's, very complex. But, at the end of the day, there's a lot that can still be done in terms of what's actually regulated and what's required. And if we go back to the basics, which